Good afternoon. I trust you enjoyed your lunch. We want to thank those that prepared it. We want to thank the members of Provincial Parliament for welcoming us here today as we continue on this very special 23rd event of the Queen's Park Day. We had the privilege as the executive this morning to present the nursing career pathways. And without further ado, Dr. Doris Greenspan, our esteemed CEO, to bring more details. Thank you.
Thank you. So a couple of colleagues were asking me if we have hard copies. No, because we go paperless. But at your table, you do have a code. The code gets you to Queen's Park. The report is posted there. So download it, please, and don't print it. I printed it to give to the minister, more or less to that. Only if she does good news. If no, don't give her a copy either. So we are going to share with you a bit about the report, just to give you an idea of how it happened, why the idea, and what the report has in terms of both content, of analytical content, and evidence, and also recommendations. So let me start where it started and why. It started with simply trying to understand how we are going to re-energize our profession. It started by me and others at the office being desperate about the type of social media that we see, being desperate about the stories that we hear, being desperate that everything appears to be or seems to be doom and gloom. And that if we continue in that path, it can drown the profession completely, and I mean it. And I have been talking about that in previous assemblies about that. And that people that, whether it's many or few, that still have a lot of energy and have a lot of good days at work, are afraid even of saying it because the majority are having a tough time. And like I said to an MPP today, I'm not going out of respect to say who, but those that heard me would know that one thing doesn't negate another, right? This was in reference about primary care and whether to have a CHC or an NPLC. One thing doesn't negate another. Having difficulties in the profession and having a tremendously challenging time doesn't negate that this profession attracts people. There are clear indications, and the numbers speak for themselves, that there is more applicants than ever before, especially to the RN program, to the baccalaureate program. It doesn't negate that PSWs, if they can afford it, because it's an issue in the PSW world more about their material situation in life, that they need to feed people, that many come as newcomers. It's not necessarily that they don't want to become a nurse, and in fact we are profiling one here that was a PSW and is becoming an RN. It doesn't negate that many of our colleagues are PNs, and where is Tanya? Tanya, put your hand up. And others like Tanya want to become RNs, and they need more bridging programs, which we have been saying for many years. It doesn't negate that RNs want to become NPs, or NPs want to have a PhD to teach as NPs or to do more research. It doesn't negate any of that. So when I met first with the policy team, the challenge that I put to them and to myself and to COMS then was, how do you balance this inspiring profession that offers so much opportunities to people? Claudette is an example. She spoke at the press conference, and IN that has done absolutely everything after I am an example. The accent in purpose, I never try to erase it, is here. I enter the world of opportunities, and yet you need to balance with the realities of what most people are experiencing in the day-to-day. So how do you create that balance, right? Without saying it's all rosy and rosy, and on the other hand, you have the reality that is not. So that's why we called it Nursing Career Pathways, or Building Careers in Nursing, Opportunities and Barriers, because we want to focus on the opportunities, but the only way to focus on the opportunities is to tackle the barriers. Now, some of those barriers are barriers that don't belong to us to a certain extent. Maybe they do belong to, because we don't speak loud enough, not at RNO, not RNO members, certainly not you that are here, but nurses in mass are not up in arms. And that's the issue of compensation. Some of the barriers belong to employers. For example, the issue of healthy work environments. I was just now in an interview, and the reporter said to me that she had seen some of the rallies, and the sign that struck her the most, that was Sam Lepre in Ottawa, you can go and watch after, was live. She said was the sign that said, I was punched, and my employer said, what can you do different next time so it doesn't happen to you? That's wrong. Period, wrong. So some belongs to employers to change their attitudes. Some belong to our own profession, and it's the issue of systemic racism and all other forms that we have of discrimination. Yes, society has the same ailment, no doubt, but we own this profession. No one else owns this profession but us. So it's up to us to tear down and show to the world that it can be done, and RNO is determined that that will happen. So when you see it in your workplace, whether by mistake or by, I didn't know, then call it out. When you see it in your workplace of nursing, call it out. And if you don't know enough to call it out, then take upon yourself to study that. Whether it is about systemic racism against black nurses, against indigenous nurses, and that is systemic racism, or whether it is other forms of discrimination against trans nurses, which will become more and more and more known, because trans people finally will get the courage to be who they are. So will nurses. So will nurses. And I will never forget, and I will not say the year just not to embarrass the person at the college, many, many years ago, decades ago, when a person at the College of Nurses called me and said, you wouldn't believe it. And I said, what is it that I wouldn't believe it? This nurse wanted to come dressed as a woman. And I said, and? Well, he's a man. And? Well, you're not going to say anything that they cannot just do that? And I said, no, I hope that they take you to human rights. Don't call me again about that, I said. So some belongs just to us. It's ours to deal with that. And the same as we did a call to action for the government in terms of compensation, in terms of safe workloads, healthy work environments for employers, I'm calling on us to clean up our house. On us, because it doesn't belong to anyone else. We can blame the rest of the world that the rest of the world is also that way, but that's not good enough. We first need to own it. And some of you in this same room here are experiencing it as we speak, because some of you spoke with me yesterday, some spoke with Claudette, and we are here to stand with you. Please know, whoever you are, if it's 1, 2, 3, it doesn't matter which type of discrimination. We are here with you, for you, and we will stand up. All the way to calling the college, or to calling your employer, or to calling whoever else. So, we hope that when you read the report, you will think when you read the report, think of 3 groups, so you can tell us if you think that we hit the mark. Think about high school students, or think about parents. You know, kids these days less than before, but still they ask sometimes parents, or parents butt in. This is one of the parents that butts in all the time, like ongoingly. I know, I need to improve that. But you know, they want to know, what should I study, what should I do, see if this hits the mark, that they will say, despite of everything that is real and they hear in the media, they will say, yeah, go to that career, because you know what? You always will have a job. That's what parents may say. Or because I know so-and-so, and she or he or they are so inspired, and so yes, they work very hard. Let's see if that hits the mark. Think if you will say to your own children or grandchildren that they should be a nurse. That will be very telling for you alone to think about that. And then think about people like Tanya, like Rebecca from NSO, that are in school still. And will it hit the mark with people in school of saying, yeah, I entered the right profession. Yes, it's tough now, but it will get better. Yes, I have the energy to keep pushing for it. And then think about colleagues that are work. Both those that still think that the profession is amazing because they had likely a good draw of the luck of where they're working. And I know of some, including the one that one RN featured here, that I spoke with her. And think how they think about the profession, especially for the ones that are not that lucky, that are, feeling burdened, that are feeling stressed, that are feeling, do I want to continue in this profession if the report does something? And then come the recommendations, right? Then it comes the recommendations, and the recommendations really are about what to do different. And what you need to also think after you will hear Cristina Pulano share some of the data, and I will introduce Cristina. What you need to hear also or think about is, will the report make a difference? Will we be able in a few years to say, check mark, check mark? This is how I go in my head. Check mark, what can I tackle next? Check mark, what can I tackle next? And see what else that is not here we need to do. So keep all of that, reflect on the report, send us feedback. We want your feedback. One more piece I would like to share is how much my colleagues and myself consulted with the field. This was critical. First, we shared with the board. You may remember we shared with the Assembly a few months ago. Then I was invited to go to Joint Provincial Nursing Committee. I didn't ask, was invited by Karima, and we will bring Karima to the next Assembly. And Cristina Pulano and I went to JPNC and heard feedback, and people, they had comments and they were excited, they wanted to hear more. Then the coupon, which is the colleges, the universities association, like an association of universities for deans and directors of nursing, invited Matt and Christina and I, and we went and we presented to them. And you will see what's different in this report, which is amazing, is that all the feedback is included, like the level of transparency, and what was done with that feedback. And you will see that the colleagues of the universities ask us, can this be used to market nursing? So that tells you how eager people are for the report. ONA asked us if they can use it in terms of the statistics and everything. RPN gave us feedback. Everybody sent us feedback, and it tells you that the report is becoming a report for the nursing community, which is really, really the intent. Yes, it's an RNO report. It's like the BPGs. Yes, are RNO-led, but the world is using them. My hunch is that this will be used by a lot of others. And that this is a report that likely I said to COU, to Coupon, the universities, when they ask if we will update, I said every 2-3 years, and Matt Jump says, oh, we can update it every year. So here you go, because it's the data that we, but never the data has been presented in this magnificent way, never before. So it will become also dashboards, right? That we can measure progress, and evidence is evidence, the facts are there. So with that, let's share with you a bit about the table of contents and how the report is structured. Basically, it starts first with really all that nursing is, and I think you will be inspired about that. And then it starts to talk about the opportunities and barriers, and then it has nursing profiles. Now, nursing profiles. My charge for Matt was only one, not a single board and not a single assembly member. That's that. Why? Because you get a lot of opportunity, right? Because we either engage you with MPPs, or you are in the media, or you are in other materials. We wanted, and I in particular wanted, people that likely you never have heard before. People that you never have heard before. One of them is an RN, Mary-Lou. I want to share with you about the first reaction of Mary-Lou when I asked her if she would write 100 words. Me? Doris, I am very good working in ICU and CCU, but I don't write well. I said, who cares? Just send me bullet points. We will put it together for you. Okay. She put it together, and you need to see what she put together from the heart of what's nursing and what makes the biggest difference for her in being a nurse. Then I said to her, she sent me a WhatsApp and said, so where is this going? Ha, ha, ha. She still doesn't know him. I go, this is going in a report, it's going to be released at Queen's Park. By the way, do you want to come to Queen's Park? She goes, what? Doris, that's for you. Honestly, it's all in the WhatsApp. That's for you, that's not for me. You're so good about that, and I so respect you. But no, leave me with my patients. That is nursing at its best. That is nursing. That's why I do what I do every single day, just so you know. So this is for Mary Lou and the other people that send their profiles. I bet you my life that even when you look at the CEO that is profiled here, a CEO of a hospital that is a nurse, that you probably never heard about that person. And like that, many colleagues that you likely never heard, and their stories will inspire you. So, Cristina Pulano is also one of the profiles here, because Cristina Pulano, you can tell the real story, Cristina. I know Matt didn't allow you kind of tell the real story with all the juices of why did you came to RNO, what made you, because some of them may be on the same spot. So Matt was right. It was about practice, and it was about what inspires you and what keeps you nursing. But let her tell the story, because maybe it's one of you one day that ends up also at RNO, of Cristina, why she came to RNO and what she does at RNO, and then you will see the brilliance of the data that she will bring to you. Cristina.
Thank you so much, Doris, for that lovely introduction. It's a pleasure to be here with you all today. My name is Cristina Plano. As Doris said, I'm a staff member of RNAO. I work as a nursing policy analyst with the policy department. A little bit about my story that we alluded to in the profile. And I actually spoke with Tanya, one of our students today, about it, because she said to me, she was in the gallery today, the media conference, and she said, I want to be like Doris, I want to be there presenting about nursing. And that's exactly how I started to, as a student, watching Doris presenting about nursing. So in 2016, I was one of the students placed for the QPD, I believe, or I think it was during Nursing Week, actually, with Mind the Safety Gap being released. So I was one of the students sitting in the gallery, admiring and learning about the domain of policy really in terms of nursing. And from there, it really inspired my decision to pursue that within my career. And so I practiced at the bedside for a number of years, but I ultimately went on to pursue a master's related to policy because I wanted to find myself in a nursing policy related role. And so I was telling my colleagues today is kind of a full circle moment to have been in the media conference again, but to be on the other side of things as a staff member. So yeah, so I can, oh, thanks.
It's good that she didn't say just a policy analyst. That's a good beginning. But she's a senior policy analyst, okay? Just to correct.
So as Doris said, I'll give a little bit of an overview about some of the work that went into this report, and it all really started with Doris wanting us to capture the feast of opportunities that is nursing. And so it was Doris's idea to actually use a diagram called Fishbone, where we'd be able to show the process of the education pathway and the career pathways that nurses can endeavor. Oh. That's okay, I can just... Did you want to tell a backstory? You want me to? Okay. So yeah, it started with Doris's idea to really showcase our profession in order to act really as a recruitment strategy. Doris always talks about in the media how there is an increased appetite in terms of increased applicants to nursing schools. And so I think it really started with that idea. And so we tried our best to really capture in simple terms for many different audiences to understand the educational pathways that nurses can go through and the different career options that nurses can explore throughout their career. And so what is basically represented in the two diagrams is firstly the domains of practice. And so the first two diagrams start the same in terms of the educational pathway. And in addition to demonstrating the actual educational pathway, more so for potential nursing students or somebody who might be wanting to engage in nursing education, we attach numbers to it to also make it applicable for a wider audience, so for researchers, for policymakers, to really understand the trends in relation to nursing education and how that plays into the amount of registrants that we have and therefore our workforce. So we've captured data related to the number of nursing graduates, which we are closely monitoring. You can see in the report that we have many recommendations in relation to increasing enrollments for nursing schools. And so by tracking that data year over year, as Doris said, we're gonna have an idea of the amount of graduates that are coming into the nursing workforce in Ontario, as well as the potential pool of registrants. Another thing that we tried to capture is the pool of nurses who are completing their licensing exams, and that's also in the top half of the graphic. And it's essentially to show nurses coming into the pipeline of being close to registration, so we have an idea of the amount of prospective nurses being registered. Thank you. So you can see that at the top half, and these are trends that we're going to monitor on a year-to-year basis to be able to track things like enrollments and so on. So that's the educational pathway, and you really go into depth within the report about the potential educational pathways that can be taken to really cater to our the members of the public that might be interested in pursuing nursing, to really understand the many pathways available to them. Now, the middle column that runs down the middle of the diagram is meant to represent the current number of registrants within our system. With this College of Nurses of Ontario. And that's important for us to understand because it translates into the prospective amount of nurses that we can have practicing within our system. And then we go on to explain the different domains and sectors of nursing to really show that there's a wide variety of roles that nurses are needed within in order to make our healthcare system function as it needs to. So yeah, this was the column about the registrants as I showed, and in comparison to the amount of registrants with the College of Nurses of Ontario, there's actually a large number of nurses who are not practicing nursing in Ontario, and that's where our policy recommendation related to returning nurses to the workforce comes into play. So we can see in this chart, based on CNO data, that there's a grand total, as of the most recent reporting year, of 188,592 nurses registered to practice with the College of Nurses of Ontario. That includes RPNs, RNs, and NPs. But when you look at the amount of registrants who were actually indeed employed in nursing in Ontario, that number was 155,604. And so in laying out the data and the numbers right before our eyes, it helped us to inspire our policy recommendations that you see later on in the report. And in terms of the domains of practice, the purpose there is really to monitor trends in terms of where our nurse is working and what type of roles. And we also report based on the level of education. So that provides some indications about where nurses are working in the workforce, and we can monitor over time the trends there. And then for the sectors, the same idea. We have many policy recommendations in relation to specific sectors in terms of staffing requirements. And so having this data in front of us in an accessible way will allow us to monitor the implementation of our policy priorities over time. And in order to substantiate the need for increasing nursing career pathways, we definitely focused a section on the report about the data indicating a nursing crisis. And so we brought forward vacancy data in relation to RN and RPNs, with the notable trend that for both nursing designations, the vacancies have doubled, more than doubled since the onset of the pandemic. And there's been a marked increase as well in the 90-plus day vacancies for both RNs and RPNs. And we also brought forward our data related to our RN deficit of nearly 24,000, as well as RN data in different sectors to demonstrate how we compare with the rest of Canada in terms of RN staffing in various sectors. So these are all found within the report. And that led us to, through this consultation process, collecting both feedback from as Doris mentioned, the Board of Directors, Assembly, nursing organizations, in order to understand what are the opportunities and what are the barriers that nurses and prospective nurses are facing that might be hindering them from exploring the career pathway that they would like to explore within the profession. And so that's where our third graphic came in. And so we represent on this graphic the barriers of compensation and workloads, as well as our 8 opportunities, and they're divided in terms of color. So the blue recommendations are representing retention-related recommendations, and recruitment recommendations are represented in pink. So this is just a visual way for us to map out the different opportunities and barriers that we identified through research and the consultation process in order to help nurses to build their nursing career pathways in Ontario. And with that, Doris, did you want to speak to the recommendations of the report briefly? Okay.
So I will speak about that, referring to the report, but more in a way that you can really easily remember all of this for media, because the goal is that each one of you can speak with at least 1, 2, 3, 4 colleagues, and that also many of you can speak with the media. So if the media were to ask you, so what are the key takeaways from this report in terms of the key challenges? 3, period. 2 that belong to the government and employers, but mainly the government, compensation. And by compensation, we mean competitive compensation with jurisdictions in Canada and with the US. That's where people go, whether from Ontario or other places. And that is competitive compensation, whether it's for RPNs that are squeezed now more than ever before, by the way, because PSWs went up and they should have gone up. The problem is RPNs didn't. And then RNs, that comparatively speaking to the country, especially as I said at the Assembly, especially if you look at the first 3 levels of an RN, we are the second lowest in Canada, right? And then compensation for NPs too needs to continue to keep pace across all sectors. And the other piece that we spoke on compensation is across all sectors. It cannot be that the nurses, whether it's RPN, RN, or NP, that work in long-term care make less money than the ones that work in hospital care, and et cetera, et cetera. So compensation is one major, major barrier. The reason why Ontario is worse than the rest of Canada has one name and only, Bill 124. Simple as that. Everybody had the pandemic. Everybody, the entire world, had COVID-19 pandemic. Ontario is the only one that had Bill 124, hence why we are dropping to the bottom in terms of compensation in this country. And here is why also we grew from 22,000 shortfall of RNs before the pandemic to 24,000 shortfall. Here is why you have 33,000 RNs in the non-practicing category, many of whom, if compensation would improve, will come back at least part-time, in my view, and so forth. Now, the issue of compensation directly drives the issue of workloads. They go completely together, because if you don't have enough nurses, you cannot improve workloads, right? And if you are not willing to pay nurses well in the workplaces, you are also not willing to improve workloads. So they go together. The same people that are deciding whether it is the government of the day or whether it is some employers and others not. When you see some employers doing better than others, just watch it, right? If they do a little bit better in the compensation for nurses, whether it is those that are unionized through other means of giving them days for education, giving them opportunities for mentorship, giving them to go to conference, whatever innovation or creativity they can use to make things better for nurses, they will have more nurses. And therefore, you can fix the issue of workloads. In the home care sector, that's the case too, because many are not unionized and some are doing better than others. These things don't just happen. They happen because there is a purpose to make it better. And if not, it's not just because we cannot find the money. So that's where you hit both compensation and workloads. If we don't improve compensation, we will never improve workloads. We will not. We may by bringing people that do pieces of nursing work that are not nurses, but that still will not improve overall the workload of nurses. In fact, many will tell you that at times it becomes worse because they need to oversee more and more people. So those are the two pieces that are critical to fix the situation of retention in nursing. Recruitment is not a problem. Recruitment, the only problem with recruitment is how many seats or funding the government allocates to colleges and universities. That's the only problem. We do not have a problem of not having people wanting to come to nursing. It's not a problem. Not our problem, at least. So that's the pieces that government and media need to understand to make it simple for them. So that's why we are speaking about the issues of compensation, the issues of workload, and then the issues of healthy work environment. And don't allow people to glaze over healthy work environments. Distill what it means, right? And you have enough that you have seen that you don't even need to read the report, right? Distill that if someone, like it happened with the media that asked me, says that the nurse was punched and the employer said, what are you going to do different next time so it doesn't happen? That someone that stands next to that person says, that's wrong. That's wrong. That's not the answer. Go and stand next to that colleague and go and speak with whoever that punched that colleague and say, this got to stop. There is a lot of talk about the issues of racism, systemic racism in long-term care. And the excuse is because of the people that work in long-term care, many times it's racialized workforce. The issue is, the excuse that is used is DDD, dementia, right? Bad excuse, bad excuse. Systemic racism doesn't just exist. Systemic racism exists if you have it in your heart. If you don't have it in your heart, ain't going to come out when you have dementia, I can assure you. I work, my clinical expertise is with people with acquired brain injuries. So I know exactly what happens because it's very similar in many ways. Just can happen at any age, right? You see the person the way the person is naked in the heart. We call it in people with acquired brain injuries. The values, the real values of the person come out. So let's not justify systemic racism in nursing homes or anywhere by dementia, please, because it's not okay. It's never okay. It's never okay regardless of the condition, as it's never okay that any nurse will be punched and the employer will say, what are you going to do different next time so it doesn't happen? Just not okay. That's what we mean by healthy work environments. It's not just whatever. It is active mentorship. It is that if you have, a new generation of directors of care in nursing homes, or first of all, they should be paid better, and not because Morgan is one of them, but it's one of the recommendations here. It's because it's pathetic, not because they don't think they're not well paid, because they go there because they have a passion, but it is not okay. In any other sector, that wouldn't be happening. And when you see 18 months turnover, that is the reason. They work the weekends, they work in the middle of the night. If someone doesn't show up, they need to go. Yes, they do it with love and but then after 18 months, many of them are gone. It's not okay. So mentorship, support for education, support to have breathers of being at events where they're supported to be there. That all is part of healthy work environments. Compensation is one, but all the rest is also very important. So that's some of the recommendations. And we have mentorship there also, and we have provide leadership training. Now, Janet Chi, Associate Director Long-Term Care, and Irmajin Bainok, that I don't know if she's here today, they developed a tremendous program of leadership that they already delivered for long-term care and for hospital care, and next they will deliver for community leaders. And you don't need to be in one sector to go to that one. In fact, I think it's great if people from one sector go also to the other, because that's how they learn system learning. The issue of internationally educated nurses, or INs, thank goodness we pushed. Because you may remember, and Matt will remember, and I don't recall if you were yet with RNO, I don't think so. But when we started to talk about INs, no one knew what we were saying. Actually, to tell you the truth, I didn't know either. To tell you the truth, when I, for the first time, saw the numbers of, it was, I think, 26,000 or whatever barbarity, I thought, are you kidding me? It was a report of the Fairness Commissioner of this province. No one had looked at that. Everybody was just, it's like people can come, make this country their home, and then nothing happens, right? And they end up working as PSWs, not because PSW is not good, but actually they want to work as nurses. They were nurses back home. And don't give me that the English was not enough and that this was not enough. Baloney. When I was hired as an RN in Michigan, in Ann Arbor, Michigan, one of the 3 top university hospitals in the US, no one, and I mean it, no one could understand what I was talking. I'm real, I'm telling you. Caroline Emmerich, who I met when they gave me the Life Career Award at the University of Michigan a few months ago, I made my point to find that woman that hired me. Her name is Caroline Emmerich. And she couldn't believe when I called her. She said, I have been watching where you're going, and I knew always you will do something, but you are calling me? And I said, are you kidding me? You opened the doors for me. You were the first person with I couldn't even speak English well, and you hired me. And here we have a problem, because I speak with the INs, and they know English. And honestly, they know English, some of them, because we are obliged in our countries of origin to know to read and write in English better than anyone. It's a must. So the accents get in the way. Well, try a bit to understand the accent, because you know what? For some it's the accent, for some it's the skin color, for some it's whatever. Enough is all discrimination. We have still, college says 6,000, my hunch 10,000 minimum INs living here waiting to practice and to serve patients. Eager. Let's open the doors. Between the INs, between the nurses not practicing nurses, we have enough to cover 2 times the nursing shortage. And then all the graduates. Now, one thing we need to give credit, because probably they're here already or coming, the minister, one thing they deserve big time credit, they did increase the seats for education. 1,000 more RNs, 500 more RPNs, 150 more NPs, on top of what we had, which means now 350 NPs every single year. We still need more. So we are saying for the next 5 years, we need 10% more in each of these categories on top of what they already announced. So the plan is clear. What we need to do is clear in terms of making things better. And if we make them better, and it's not insurmountable what we are asking, it truly is not. Just picture how fast we could fix the health system ills and how much we would be able to keep nurses here in Ontario, having careers in Ontario, whether the RPN wants to stay as an RPN, whether the RN wants to stay as an RN, or whether they want to move from one area to another or from one category of nursing to another. I don't want to end before thanking a few people about this report. First, Matt, Catherine Pulano, with whom I work very closely on all of the content of the report. Second, Zina. I don't know if Zina is here. Zina, the scissors of RNAO. Is Zina here? Zina, stand up. I call that woman. I say to Zina, Zina, here it is. Do your scissors with the report. It means cut, make it sharp. Marianne, that oversees communication. Nishant, that created this beauty and has the patience of, in Spanish we say, of an elephant. And everybody that reviewed the report, including colleagues from other organizations. And we look forward to having your feedback, because we know that your feedback will enrich the next version of it. And give it legs. Talk about it, share with it, and distill it in simple words. We will send you our speaking notes so you can use them. Distill it in simple words for colleagues, for friends, for people in the community, and yes, for the media, please. Thank you. Thank you. Anyone has, we have 5 minutes. Let's divide it into this. Minister Jones is coming in 5 minutes and everybody needs to be back. You can fill up your coffee, you can go to the washroom, you can fill up your tea, or you can ask questions. Everybody should do whatever they need to do. By our president, Minister Jones. Another one that will be introduced by a minute by our president, Minister Calandra, and one that I am going to welcome, who is Dr. Karima Belgi. Karima, say hi. Okay, people heard me speak about Karima, so we will have a whole session with her at the next assembly. And yesterday I already said, Karima, that people will be very interested in sharing some of their experiences and opportunities with you. So I will invite our president to introduce very quickly the two ministers and then the two ministers.
Good afternoon again, and thank you as I welcome the two honorable ministers. First, in the order that I was given, just in case there's any discussion as to who went first, the Honorable Sylvia Jones, Deputy Premier and Health Minister, MPP of Dufferin-Caledon. Sylvia Jones is Ontario's Deputy Premier and Health Minister. In her role, Minister Jones has introduced a plan to stay open, Ontario's 5-point plan to strengthen the healthcare workforce and stabilize the health system by providing fast access to care and more care options in the community. Previously, the minister served as Solicitor General from 2019 to 2022, where she championed public safety initiatives, including leading the country with a $307 million anti-human trafficking strategy and legislation, and passing Canada's toughest animal protection legislation. Minister Jones has lived in Dufferin-Caledon for over 30 years with her husband, David. Let's hear a round of applause for our minister. And now, the Honourable Paul Calandra, Long-Term Care Minister, MPP Markham-Stouffville. Before being elected to the Ontario Legislature in 2018, Paul Calandra was a federal member of Parliament in 2008 and 2011. During his tenure as MP, he served as the Parliamentary Secretary to the Prime Minister and to the President of the Queen's Privy Council. Minister Calandra first got involved in provincial politics to bring change to Queen's Park. He ran on a platform to lower hydro bills, make life more affordable, and unleash the economic engine of Ontario. Minister Calandra lives in Stouffville with his wife Melanie and two daughters, Natalie and Olivia. Welcome.
Well, thank you, Claudette, and it's wonderful to be able to join you in person. We've had far too many of those Zoom meetings. Doris, thank you so much for first inviting me, but most importantly, introducing my secret weapon at the Ministry of Health, and that is Dr. Karima Belgi. She came on board in the fall and has been an incredible asset to me and to our team at the Ministry of Health. So, thank you. So again, thank you for all of the membership at the RNAO and your leadership, for your ongoing leadership in advocating on behalf of nurses and patients, and continuing to be a strong voice for building a more connected and convenient healthcare system here in Ontario. On behalf of Premier Ford and our entire government, I want to thank Ontario nurses for everything you do to provide exceptional care to patients and their families. Your tremendous efforts were essential in helping Ontario navigate the challenges we faced during the pandemic, and your efforts truly made a difference. We are second only to Japan in leading the world in our response to protecting against and vaccinating for COVID-19, and that is in no small part because of the work that you and your members did in community. 2022 was a record-breaking year for new nurses in Ontario, with over 12,000 new nurses registered and another 30,000 students studying nurses at an Ontario college or university today. But we need to do more, and we are doing more. The Premier and I had the opportunity to sit down with your leadership in the fall. We made a promise that we would continue to work together with the RNAO to support nurses currently in the workforce and ensure we find ways to bring more nurses for future generations. Our government understands our health system and healthcare workers are still facing significant back pressures, and patients continue to face challenges when accessing the care that they need, when they need it, and where it is convenient to them. That is why our government unveiled our new vision for healthcare entitled Your Health, a plan for connected and convenient care. Growing our healthcare workforce is a key part of this plan, and we are continuing to add more healthcare professionals to the health system and expand the education and training opportunities for those already working within it. We have also directed the College of Nurses of Ontario to break down barriers for internationally educated nurses so they can register and practice in Ontario faster. We have removed financial barriers for new nurses wanting to upskill to work in critical areas of hospitals. And by this spring, close to 500 registered nurses will have completed their upskilling education. And I have to say that is in great part because of the leadership of Claudette and Doris, so thank you for those suggestions. Through our Learn and Stay grant, we are supporting eligible nursing students with full upfront funding for tuition and books in exchange for working in an underserviced area after they graduate. We're also adding 150 more education seats for nurse practitioners starting this September. And with our new as of right rules, Ontario will be the first province in Canada to allow nurses and other healthcare workers registered in other provinces and territories to immediately start working here in Ontario without having to wait to register and process through the Health Regulatory College. We are ensuring that nurses can work within their full scope of practice, and the ministry has already begun the work necessary to advance the college's regulation proposals to allow registered nurses to prescribe. Long time coming, but we're getting there. We are also connecting thousands of patients across the province with more convenient care closer to home through new clinics led by nurse practitioners. As our population grows and we age, we need more primary care providers in Ontario. And Ontario is leading the country in working with nurse practitioners to make primary care more accessible in our communities. We cannot improve Ontario's access to care without growing our healthcare workforce and supporting nurses as well as other frontline healthcare workers already serving in our system. I look forward to continuing to work together to build a more connected and convenient healthcare system, and I do that with the advice, support, and ultimately implementation of organizations like the RNAO. So thank you, stay well, and now I will turn it over to Minister Calandra.
Thank you, Minister Jones. It's always a little nerve-wracking when you have to speak after or in front of two of your bosses, the Deputy Premier and Dr. Doris. Who was truly, she was rewriting my speech this morning at the breakfast. Anyway, she was trying to give me a different copy, but I'm actually quite afraid of Doris most of the time because I know if I don't do what she says, she's gonna. Anyway, I digress. But look, thank you very much for allowing me to be here today, and thank you for inviting me. It is really nice to have people back, as the Deputy Premier was saying. It's really nice to have people back in the building and talking and lobby or information days. They're just so important to all of the members. I can't tell you how important it is in helping us frame and have a better understanding of what it is that you're doing, what it is that you need for us to do. So it is just very, very nice to have everybody back. And Matthew, we served in Parliament together, and one of the best policy minds that we had from 11 to 15. So it was really, really nice to. I never liked debating Matthew because like I could just give hyperbole and he would always have facts, so it really kind of didn't go well for me. So, but anyway, thank you very much, and again, thank you to the board for letting me be here today. As Minister of Long-Term Care, it is obviously very, very important to me that we continue to connect very closely and that I listen to you and you be able to tell us what it is that we can do in long-term care to ensure that we build a better long-term care system. We obviously cannot do that without better understanding what it is that our nurses are facing in our long-term care homes. And as I said, this is why a day like today is so very, very important. The RNAO has been and will always continue to be a very, very important partner of the Ministry of Long-Term Care. And I think it works because we do share a very common goal. The goal is to build a better system, a better long-term care system for the people of the province of Ontario, a system that is more convenient for people, a system that recognizes that a long-term care home is just that, somebody's home, and that the people who are working within long-term care want to be respected and want to have the best place to work in so that they can continue to provide the type of care that they were trained to do and that they want to bring. So I thank you for that. Nurses truly are the foundation of the long-term care system. It simply would not function, long-term care, without all of your hard work. And I think you all know that, and having a politician who is not a nurse tell you that might be a little bit annoying, but it is very true. We get to go, Minister Jones and I get to travel across the province of Ontario, been going into a lot of long-term care homes, obviously, and to be able to sit down and talk to nurses, to sit down and talk to the PSWs and hear what it is that they want to accomplish has really, really been uplifting. And we couldn't do that. For so long, we had to stay out of our homes and make policies based around a cabinet table and based on some of the things that we were hearing. And it is so nice to get back in there and just to hear what it is that our nurses, what our PSWs, what our residents want to see in long-term care. So I wanted to let you know that we are listening and we are working very hard to ensure that nurses, our PSWs, can build careers, long-term careers, and that is why we're implementing a wide-ranging suite of actions to help train, hire, and retain nurses in every region of the province of Ontario. These actions, I would suggest, are historic, bold policies, and innovative ones. As you all know, we can't fix long-term care without fixing staffing in our long-term care homes. We have a plan that would see us increase care to 4 hours of care per day, and that requires us to hire 27,000 additional healthcare workers in all fields, PSWs, allied health nurses. So it is a big role to fill. This commitment of 4 hours of care will make us a leader in all of Canada, frankly. And it is a commitment that we will meet. It is a commitment that comes with a $5 billion price tag, which, when one considers the change that it'll mean for the people who are in long-term care, is a very, very small price to pay. And I have to honestly thank the Minister of Health and Deputy Premier, who has been I came to it to long-term care a short time ago, and a little over a year ago, but the Deputy Premier and the work that she had done as Solicitor General really helped lay the foundations, which made it easier for us to get here to where we want to be with the 4 hours of care and the other things that we're accomplishing. So we would not have been here without her. So one of the things that we were trying to do in order to increase and make sure that these investments are targeted, of course, is hiring more nurse practitioners, as the Deputy Premier talked about, for long-term care program, which we launched last October. Now, I don't know if anybody saw that news conference, Dr. D was at the news conference, and nobody wanted to talk to me. All they wanted to do is talk to Doris. And thank God you were there, because you were able to answer a lot of the questions that I couldn't. So she took over that news conference, and it was awesome because the policy really helped, because some of the discussions that we had is what helped lead us to that. And the work that you and the board have done helped lead us to having a better understanding of the value of nurse practitioners and the roles that they can play in long-term care. So through this program, we're investing in the recruitment and retention of up to 225 additional nurse practitioners for long-term care. We're also working to ensure that we can address human resource shortages in communities that need it most. And that's why the funding provides up to $5,000 in relocation support for nurse practitioners who are hired full-time and agree to provide services for at least 12 months in rural communities. We're also investing $73 million over 3 years to train and provide critical placements for over 16,000 nursing and PSW students through the Preceptor Resource and Education Program for long-term care. This program provides more opportunities for career development within long-term care and ensures that nursing and PSW students receive hands-on experience to better serve the needs of residents. Now, clinical placement experiences also support recruitment because many students take jobs in the homes where they completed their placements. And at the same time, the program provides existing long-term care staff with an opportunity to oversee students. This helps with staff retention by creating an opportunity for career development and growth for the staff member. We are also implementing innovative health system-wide solutions that help nurses build their careers in Ontario. These efforts include the recently introduced As a Right, as the Deputy Premier talked about, rules which help make it easier for nurses from across the country to move to Ontario to start working, and initiatives that make it easier for internationally educated nurses to join the workforce. Now, critical to strengthening our long-term care system is ensuring nurses have quick and convenient access to the most up-to-date sector-based practices. And that is why I want to announce today that we will be extending funding for the Clinical Decision Support Tool. This funding So this is your draft. Really, I was coming to the breakfast for 5 minutes, and then I didn't see Dr. D, and then all of a sudden I heard Paul, and then there was, this is the speech. And I said, okay. I said, no, it may be the speech. And she said, no, this is the speech. Lo and behold, this is the speech that I'm reading. So I don't know how you've done it, but anyway. And look, it is a really good program. I have to tell you, it is an absolutely spectacular program, and I thank you very much for that. But look, a lot of things that we also talk about in long-term care, one of the things we also talk about, of course, is building new long-term care, because we really want to transition long-term care to being a home for people. For far too long, long-term care was looked at, and I get in trouble sometimes saying this, as a warehouse, you know, where people would go, it would be the end of their lives, but that's not the case in long-term care anymore. And by and large, it's because of the work that you are doing in our long-term care homes. People are living longer in long-term care. They're having better outcomes in long-term care, better lives, or better social, more social activities. And we are seeing a very, very positive change. We're seeing that with the 4 hours of care, but it also includes building brand new long-term care homes in different parts of the province, getting rid of those 3 and 4 ward bedroom homes, making sure that you have modern homes that include infection prevention and control built right into it, that might offer some of the diagnostic tools that for too long were taken away from you, but you can do. Like, there's so many more things that our nurses can do in our long-term care homes, and we are working very closely to ensure that we can do that, because every time we can give somebody greater access to better care closer to home, it is a win for the people that we represent and the people that you service every day. And what we're seeing with the new modern homes, frankly, is that people want to come back into long-term care. It is a commitment in total, an over $13 billion commitment in staffing. It's in new homes, 60,000 new homes, and we are doing this in small communities as well as cities, as well as medium-sized. We are bringing long-term care all over this province because we want people to live in the communities that they help build. It is a very important part to us. And just last week, I'll conclude with this, just last week, we met our commitment to double the amount of inspectors in the long-term care system. We have the highest inspector-to-home ratio in the country, if not North America. More than one inspector for every 2 homes across the province of Ontario, because we heard loud and clear that it was time to put resources back into our long-term care system. It was time to transition it so that people could be in a home. The outcomes that, because of what you have been providing, are better. And we as a government have to ensure that we give the people who we represent, the people who are living in those homes, the absolute best opportunity to thrive. So that, put all of that together, I'm very, very excited with the work that the minister is doing on bringing in Ontario health teams. It is a very, very exciting time to be in healthcare. It is a very exciting time to be the Minister of Long-Term Care. I don't think it's funny. I think it's so funny because we are doing that work finally, right? We're doing it finally. When I think of the chance that we have to sit down, Dr. D, once a month, Lisa Levin with the OLTCA, and to hear what people are saying, and then to actually get things done once and for all to make the system better, it's not going to be easy. There is a lot of work to do, obviously, still. And I know, you know, sometimes you think that it's a challenge, that government isn't listening. But this is a once-in-a-lifetime opportunity. I'll just conclude by saying this. Never have you had an opportunity where your federal, your provincial, and your municipal governments, along with all of you, are focused on making our healthcare system better. And people will not forgive us if we are not successful in what it is that we're trying to set out to do. So thank you very much for having me, and thank you, Dr. D, for all of your help.
Now I need to distill it for you. Before we go to questions, Paul Andre, let me first distill the conversation and the news. And let me give my take to it. First of all, Minister Jones, I want to thank you. I did a quiz today in the breakfast. I put all the MPPs that were there, didn't matter which party, and I said the nursing quiz. Dr. Schultz, have you heard about that? Yes. Increasing wages, have you heard about that? Yes. Nurses calling that they want to expand the RN, calling that they want to expand the clinic. They want to do RN prescribing. They want to do RN prescribing. They go, yeah. I said, when was this? Tell the Premier. Not always I like when he says, get it done, but the minister today said it, get it done. This was in 2012, announced. RN prescribing was announced in 2012. Well, no, that's when we were asking. We announced it in 2012. But government announced it a few years later. Then Kathleen Wynne announced it. Then Minister Minister Eric, like you call me Mr. D, I forget his family name too. Mr. Eric announced it, and you are saying it will be implemented, and I have every reason to believe it, Minister Jones, because I saw the letter to the college. Let's make it happen, 2023. June is our AGM. Let's announce that. Doesn't matter if it's 5, 10, 20, 30, that they can take the course. The day that that will be inserted into baccalaureate entry to practice is the day that you transform healthcare. Between that, nurse practitioner-led clinics, which my colleagues from Peterborough and Aurelia say hi, we're waiting for an announcement. It will come, I hope. Will it? Yes, you have 30 million in that budget. We want 4 million, 2 and 2. For those 2 clinics, you have 30, you have 26 million left. So, Minister Calandra, about you. The passion that you have for long-term care, I saw it from day one that you called. It's a passion that I have not seen in many ministers that have taken long-term care. Rod Phillip had some of that passion too. You have it double. And I do think that we will make things better. Between nurse practitioners in long-term care, He says 1 per 125, I say 1 per 120. We can settle in 125 for this entire province, having peace in long-term care, having the 4 hours of care, having the clinical pathways. We are going to become a sample for the world. For the world. Watch it. Watch it. Morgan Offert, who is the past president of RNO, I understand she said hi to you today, Minister Calandra. She is director of care in nursing homes. That's your next challenge, not because she will say it, I'm saying it. There is a turnover of directors of care in nursing homes every 18 months. Every 18 months. And it's simply because their workloads and their compensation. She never says it, Morgan, because she goes in the evening, at night, on the weekends, whenever there is not a nurse, she's there working. But we need to tackle that next. We are going one by one, and we are going to be a winning team and make nursing homes in Ontario an example for the world. It will be a tragedy of the pandemic paid forward for the next generation of people that need nursing homes. I truly believe that. So thank you to both of you. My colleagues want questions. Paul Andre was first. Then I'm going to go. Who is Julie there? Oh, okay, fantastic.
Hello.
And then here, and then Rebecca. Don't leave her without a question. Rebecca is the president of the nursing students of Ontario. So we got to, let's give her first, Paul Andre. Let's give Rebecca. Let's give the next generation. Go for it, Rebecca, go. And then Paul Andre.
Hello, good afternoon. I think first off, just thank you so much for joining us. I know as a student, this is my first time here, so it's really exciting to be exposed to so much different knowledge and things I didn't know, so thank you so much for coming. I think my question just is around, as a background, this is my second degree, so I had some schooling previously. I'm now a mature student, so I'm a little bit older. There's also, you guys have done a great job of offering different funds and bursaries and ways to help fund education, but I think where we're really struggling as students, specifically those that are mature, is just having perhaps some sort of fun when we're doing our clinical hours. So in our last semester, we're supposed to do 420 hours. That's full-time at a hospital or at a long-term care home, and that's all that's all unpaid. So just for someone who's coming as a mature student, I was just wondering if there's anything in the pipeline for possibly funding or offering something for those students who do decide to stay in Toronto, just to help us kind of with our housing expenses and our families and being able to pay for rent and food and all sorts of things. Thank you.
Can you hear me?
Yes.
Excellent. Well, congratulations, first of all. It's a really interesting point because, of course, most medical clinicians and medical practitioners have a component of their education that is exactly to your point, that residency or the in-person. And Karima will correct me later if I'm wrong, but as I understand it, none of them currently are paid. Now, I will say that while you have Minister Calandra and myself here, there are many, many ministries that could come here and share what they are doing, particularly to bolster their area, whether that's Jill Dunlop in colleges and universities, Minister Lecce in education, with the additional nurses hired in our school system to make sure that our children are protected. So let me take that one away, because I think it would have some implement issues in other healthcare practitioners who are also going through the training process. So I'm going to have to take that one away with the experts, including those in colleges and universities. But thank you for the suggestion.
Minister, I do need to say that you are very generous. Minister Calandra will tell you that when we met the first time, I said your biggest enemy is Minister Jones because she will want all the budget, so grab some before she takes it all. But here you go, here you go. And you did the same now with Minister Lecce, who spoke with me today. We're going to talk with you about making permanent that 625 nurses for the schools. That's amazing for the students. So thank you for your generosity of working with your colleagues. Thank you. I think Paul-André.
Paul-André Gauthier, I'm a doctor in nursing, and I'm president-elect of the Clinical Nurse Specialists Association of Ontario. Thank you, Minister John and Minister Calendra, for attending the meetings today and helping us to understand a bit more what we're doing. There's a few things I need to raise. I'm from Northern Ontario, and one of the concerns was saying Toronto have some challenge, but in Northern Ontario, you wouldn't believe the challenge we have. One of them is the parity with the salary of nurses outside of the hospital. They are paid less. They are draining the community nurses to go to the hospital because they are paid way more. And that's one of the challenges we need to look at. Late career initiative. Nurses who are older like me, 40 years of experience in nursing, need to be involved in helping the new nurses coming in who are lacking support in the healthcare institutions. We need to bring that back. Also, private healthcare. Surgeons are telling us, I don't have enough time in OR in the hospitals. They are ready to do 2 more days of surgery in the public hospital, but the public hospital are lacking the funding for them to do surgery in the public hospital. We need to pay attention to that. Not private clinics, the hospitals need the money to be able to do it, and they have the staff on hand, way less costly. Last comment. My last comment is about the nurse practitioner clinics. We need way more. In Sudbury, we have a few, but we need 3 more in order to remove people from ER. The hospital is becoming the clinic for people to go because we're lacking the service. But the nurse practitioner clinic can work 5 days a week, and they can provide primary care to a lot of people who do not have access to physician. The hospital ER is not the solution, and I hope you're going to help us. Thank you so much for being here.
Doris, how much time do I have to answer that question? So a couple of things. You've raised some really important issues. Look, it's not an either or. We have, as a government, invested over $800 million in a fund specifically for hospitals to expand their operating room capacity when they have capacity. That is ongoing. In this year's fiscal alone, it was $300 million available exclusively for hospitals to expand their OR capacity. And in many cases, it has worked. Of course, we still have those waiting lists. So we need to do both. I will quote the Premier by saying it's not an either-or proposition, it's an and. This is an expansion because we see that patients are waiting too long. In particular, your comments about Northern Ontario and the parity piece. You know, when Minister Calandra and I first started talking about alternative level of care and the concerns that we had with people who were languishing in hospital beds that really should have been served in other agencies and opportunities in community, we consciously worked together because we understood that you cannot bolster one part of a system without impacting others. So you will see that because of the work that we have done together in long-term care and hospitals, the alternative level of care numbers have gone down dramatically. Why? Partly because of the leadership that we made sure policies and procedures were in place at the provincial level, but also because hospitals and long-term care, for the first time, were working together. You know, we had, and I will use my own community as an example, my local hospital did not have close connections with their long-term care homes. Why? Because they didn't need to. And then the pandemic arrived, and the hospital stepped in to assist long-term care. Those bridges, I call them, are going to be strengthened with Ontario Health teams so that we make sure that not only do we have robust care in hospitals, in long-term care, but also in community. Because we know that there are different wages and different benefits, different opportunities depending on where you choose to nurse in the province of Ontario. But we have to be very aware that there are costs and concerns that we have to watch. You will see through our legislation expanding clinical and diagnostic in community that part of the application process very clearly talks about Where is your partnership with hospital? Where is your partnership with community? And how are you going to actually do this with existing HHR? So map it out so that we in the ministry can make an assessment to say that is a doable application. There is a need in that community and we will fund it. Thank you. I don't know if you had, and thanks.
All right, so first I want to say thank you very much for giving me a glass of water. I'm pretty sure you have a nursing heart, that there's a nurse in there somewhere because you saw me struggling and you're like, here's water. All right, so my name is Shannon Clausen and I'm a nurse practitioner, and I've been a nurse for over 25 years and a nurse practitioner for over 15 years, almost 17 now I think. And I work in North Bay, Ontario, so I'm also familiar with the struggles of the North. I am here with my nurse practitioner colleagues and some other in the room to say our ears perked up when we heard you say nurse practitioners as a solution for primary health care, and we'd love to know more about what your plans are for that. And my other ask is if you would acknowledge for us that primary care is in crisis. If you could acknowledge that as a crisis, because we have so many orphan patients in Ontario. We have so many doctors who are going to be retiring, a huge number of doctors who are going to be retiring. So we have more people who are going to be orphaned, and we don't have the infrastructure ready to support that. And so I'd love to hear you say that primary care is in crisis. And ideally, also hear you say that nurse practitioners are part of the solution to that.
So without a doubt, nurse practitioners are part of the solution. We've seen it, Ontario has led Canada in utilizing and ensuring that nurse practitioners practice to their full scope. They absolutely play an important role. We have, I believe, 27 operating in the province of Ontario today, nurse-led practitioner clinics, and there is absolutely a role. Why don't I use the word crisis? Because I don't want that mother, father to be hesitant about going into an emergency department, about making that phone call to 911, about having I don't want another stressor for them to be, I don't want to be part of the problem. And it's really important for me to show that we are doing things in the province of Ontario differently. We are embracing some innovation and change, but I never want a patient to think that in the province of Ontario, they are going to be turned away or refuse service, or worse, make a decision not to go to the emergency department or dial 911 because they think they're hurting the system. I cannot have that, and we don't have that. And I have to tell you, and I'm sure everyone in this room has the same stories, when people talk to me about their experiences when they are going through cancer, when they are going through an illness, a treatment, they really appreciate what we have been able to do through the pandemic and now as we are leveling off. So that's why I don't use the word crisis.
Can I just do a follow-up? Is that okay, Doris? Sure. Okay, so I want to
That
follow
is
up
the
with
line.
that and just say that, I mean, people are already afraid to go to Emerge because of how long they have to wait in Emerge, because the Emerges are overwhelmed and understaffed. And so it is already a crisis, and people are already suffering at home. Thank you so much. Thank you for the water.
So, Minister, the reality is, I understand your perspective of what you're saying. The tragedy is that while you are afraid that people will be afraid of calling 911 or going to the ER, or my colleague is saying crisis, you have groups, one at the mic, Aurelia. You have Peterborough ready to go. These people, these MPs are working full-time now and put a proposal that has, before it even got to you, was a year in bureaucrats' tables. That cannot happen because if you don't want to have at the end of the day a disaster, because it's already, then these clinics, which the same as you are saying, is not either or, which we can have another discussion about not either or. Here clearly is not either or because community health centers, family health teams, NPLCs, all are publicly funded. It's not either or. And so if Peterborough has a community health center that the MPP wants there, fabulous. But there is also an MP ready to go clinic, ready with people eager. It's not either or because there are about 30,000 people without access, and even the CHC and the NPLC will not cover all. Aurelia, 15,000 unattached patients, 6 doctors retiring. It got to happen, and I think you have a problem that you and Karima need to tackle, and maybe I don't know how much Minister Calandra is or is not involved, but I will tell you have a problem with Ontario Health in that area, that they're not moving these initiatives fast. Yes, they want integration. You too, me too. Everybody wants integration. But if I am a patient, if I am a simple Ontarian that needs to call 911 instead of going to primary care, there is no integration for me. It's all talk for us. They need to be attached to primary care. For them, that is integration. So I think you need to have a conversation with Ontario Health on moving faster. Integration needs to continue to be pushed, but the services at the ground need to happen.
Hi, Minister Jones. My name is Janet Graves. I'm a nurse practitioner. I'm one of partners who have put forth that proposal for Aurelia. And just to quote your, just to sort of tail onto your health, in there you noted that there were 25 nurse practitioner-led clinics in Ontario that were serving 80,000 people that were previously unattached at a cost of $46 million. Do the math. We're economical. We're the solution. We're ready to go. These are your Ontarians you're saying no to. It's not me. It's your Ontarians that need you to say yes and to make this green light so that we can get started.
So also in that Your Health document is an acknowledgement and a commitment to increase primary care in the province of Ontario. So we're not saying no. We haven't chosen yet because there is a lot of process and a lot of due diligence that goes into where are the communities that are most in need, i.e. the most unattached patients, where are the communities that actually have the capacity now to expand or offer satellites. So that work is happening right now. You know, in the Ministry of Health, we've always had this process called basically you can put applications in without a process. And initially, when I saw that, I said, why do we accept proposals when we don't actually have a plan for where the expansions are coming? And I will tell you, frankly, I wasn't particularly happy with that process. I have now changed my mind because, frankly, that's where the innovation comes from. That's where we're seeing we have, I will use nurse practitioner-led clinics as an example. We have a clinic that is offered in Community A. We can offer a satellite in Community B. We've done the research. We see that there are X number of unattached patients. Yes, there will be due diligence that happens at the Ontario Health level to actually trust but confirm the information. But in our Your Health document, we are committing to expand primary care in the province of Ontario because we know we need to. So thank you.
So I guess my question is, why the delay? Why not allow us to start now? In North Simcoe, Muskoka, there are 73 doctors per 100,000 patients. Provincially, we're 93%. We're 20% below what the provincial average is. So that's a hard data to refute, that the need is not there.
And we have to do the due diligence across Ontario to make sure that there aren't communities in Northern Ontario and Southwestern Ontario in Niagara that also have the capacity and the opportunity. So we're doing that work, but we have made a commitment in the Your Health document to expand primary care models in the province of Ontario.
We got to continue. 2 more questions, simply because on the mic, you were first actually, and then Morgan, and then we are done, because we have our guest, the new leader of the NDP also coming. Minister, process, but these proposals have been a year waiting. I think you need to fasten the process of your civil servants on that. Please.
Great, thank you. Hi, thank you so much.
Polita, we will not take more questions, guys. 1 here and 1 here, Morgan, and that's it.
All right, thank you. It's a pleasure to join you here today and to share space with you. I'm Jocelyn Ratcliffe, and I'm the co-chair of the Ontario Nurses for the Environment. I'm going to move the conversation a little bit differently, but nonetheless in the area of health. So in the fall and winter, thousands, including the RNAO, spoke up about the ways that Bill 23 would add to the environmental crises of biodiversity and climate, and the clearly linked impacts to food, water, and air, ecological determinants of health. We know that if we don't prioritize action on these crises through conservation, rehabilitating, and conserving more land, and emissions reductions, as well as appreciating the huge benefits of nature, our health crisis will deepen. Will this government prioritize the health of people now and in the future by preventing irreversible environmental impacts and repeal Bill 23?
Yeah, look, I'll tell you, no, right? We wouldn't pass a bill if we didn't think that the bill was important for the people of the province of Ontario. Look, when you talk about environment, one of the leading causes of greenhouse gases anywhere, in any jurisdiction across this country, across North America, across the world, is through their energy procurement. We have one of the cleanest grids in the world right here in the province of Ontario, and that is why so many people are choosing to make investments here in the province of Ontario. Our nuclear reactors, our hydroelectricity, some of the work that we've done on alternative energy has given us one of the cleanest grids anywhere. That's 94% clean. So that is the first start. We have expanded our parks in the province of Ontario more than any other government since, frankly, the Mike Harris government. We are doing work with our producers to ensure that we can remove things that would have gone to landfills before. We are changing that. When you look at the development that we're doing in infrastructure across the province of Ontario, we have the largest investment in public transportation, not only just here in Toronto, a $28 billion investment in subways and GO trains, but in other parts of the province of Ontario, including in Ottawa and in Hamilton, because when we can get people onto public transportation, it makes our environment cleaner. We have a Made in Ontario environment plan. We are moving actually in the right direction when it comes to our greenhouse gas emissions, but when you look at the infrastructure and the things that we're building, every brand new long-term care home I build replaces an old long-term care home that was not energy efficient, that did not pay any attention to what it was releasing into the air. It's not just about infection prevention and control and the working conditions for all of you in a home. These are 58,000 new and updated beds, which will be of the highest standards, which include the environmental standards. When you look at the new hospitals that we are building in small and large communities across this province, we are all doing that with the highest environmental standards. And when you look at what we need to accomplish in the province of Ontario, and it's not just here in big cities. We have an enormous housing problem. I am building long-term care homes in many different parts of this province. I am going to small communities. I was in a place called Athens, Ontario. It's a 200, and if I'm not mistaken, 225-bed long-term care home. The long-term care home will be the biggest employer. The long-term care home will be the biggest property taxpayer. You know what the number one problem that they have is ensuring that they have enough housing for the people that will be coming to work in that home. So they're taking the old home and transitioning that into residences for nursing, as they look at how they can build more housing in their communities. Each and every one of the people in this room, hopefully, I know my parents, when they came to this country, the number one reason they came, yeah, you build a better future for your kids, and the number one thing that they wanted to do when there was 10 of them living in one house, uncles and aunts, was to buy their first home. That is not a possibility in the province of Ontario for a lot of people. So when you talk about the young, the student who is working on her second degree, working very, very, very hard, I don't want to be part of a government, and I know none of you here want to be part of a government or part of a province that takes away the dream of home ownership from somebody who then forces them to leave. I get very passionate about this because we can make a cleaner environment, we can build new homes, we can give people the opportunity to succeed in the province of Ontario like generations have before us. And it is not our job, those of us who have succeeded from the work of other people, to take away that from those who are coming behind us. It is our job to give them every single advantage that we had, not to take it away from them. And that's what Bill 23 does. That's why we're working hard to build more houses. That's why when we bring more people in, gosh, when you talk about, look at some of the hospitals that you're building in some of the smaller communities, the impact that will have. You know, it would be easier to close a small hospital in a small community and centralize and make it in a big place. But that's not good for patients. It's not good for the people that you serve. And you can only do that if you have housing, if you have infrastructure, and everything else that makes a community good. And I'll tell you one last thing, and I promise I'll stop, Dr. D. When people look at investing in the province of Ontario, they just don't look at tax rates anymore. They look at our grid. Do we have a clean grid? Do we have good schools? Do we have good hospitals? Do we have good colleges? Do we have good roads? Do we have good infrastructure? Do we have good, safe communities and skilled workers to support the thousands of jobs and the investments? You can't do one without the other. So the environment is important, the investments in health is important, more nurses is important, but it is also hugely important that we give people the opportunity to live, work, and play in the very same communities where they choose to. And there's no point in making investments if we can't have you live in the exact same communities where we want you to. So I appreciate what you're saying, but we can do both, and we are doing both in the province of Ontario. Sorry for going on so long. I get very passionate about.
I know we ran out of time.
Thank you. No, thank you, Morgan. Thank you. Just out
you
of
may as well
respect to
keep the
Merit
mic
Styles.
because this one's for you too. So thank you very much. I'm Morgan Hofarth. I'm the past president of RNAO, and I'm the director of care at a 375-bed long-term care home in London. Thank you for your announcement about the clinical decision support funding, hopefully with the intention of homes to implement the RNAO point-click care clinical pathways. Previously, the clinical decision support funding is one of the only pieces of funding in long-term care that's not tied to the number of beds that you have in your home. And for homes that are large, it's not sufficient funding to implement the pathways because point-click care charges per bed that you have. Can you elaborate on the clinical decision support funding and the intention of that funding?
Yeah, look, I will tell you this, just actually in long-term care as a whole, when it comes to funding, it is something that we really are taking a look at right now across the board, right? Because it has changed so much, right? When we first started out to build 58,000 beds, inflation was not an issue, and we didn't have to worry about it, right? Well, now we had to double the funding in order to get to the 58,000 beds. When we said we wanted to bring 4 hours of care and hire 27,000 additionally, well, you know, that was pre-pandemic. A lot of things have changed, so we knew that we had to do more. Dr. D has been very, very instrumental in helping us understand how do we provide better education and better pathways in the homes. How is that a part of making our homes safer? And I think it's an important piece that we are going to start to look at, because we are hearing it from the homes, whether it's from Advantage Ontario or for the Ontario Long-Term Care Association. We are looking at how we can best fund so that the outcomes are better. And I acknowledge the fact that perhaps the way we segment our funding in long-term care right now does not meet the needs of what we are asking you to accomplish. So we actually are looking at that right now, because it's an older model that is very segmented, and I think that we can do better, and I think there are other opportunities for us to like frankly, like I know you get sometimes it's frustrating, Dr. D. Like I get it, but truly, we just came through a global health and economic pandemic. Right? You were asked to do things that nobody has ever been asked to do anywhere, and we are making, as much as it can seem challenging and difficult, in long-term care and in health, we are building an integrated system, because the one thing I hear all the time from people is, once I get in the system, it's wonderful. But getting into the system is the most difficult thing I will ever, whether it's home care, whether it's long-term care. And that is the one piece too. You want to talk about crisis, making it easier for people to access the great services that you do, so that they don't have to stress about it. That would be a game changer for so many people. And that's where the Ontario health teams and that transition that started in 2018. 2018. This is about generations of doing it one way and moving to a different system. And we can do it. We will do it. And if we don't, the next generations will not forgive us, because we had this opportunity and people are on board with it.
Thank you.
To say yes, we're looking at that because you're right.
I know we will continue the conversation. I do want to thank you, and I think next year we are going to invite the two of you and Minister Lache, that I know that he and I will cahoot on those 625 nurses, and I heard you already providing support for that to become permanent in the schools. Kids need that. As he said to me this morning, this is not about the nurses. The kids need that desperately. But it's wonderful to see how you are working together and supporting one another. And I should not have said to you that she's your worst enemy, that she will get all the money and you nothing, because she's helping you. So here you go. I don't even know what it says, because someone gave it to me last night. So hopefully you will not regret what the editor's writing. That's well. Who knows what the editor well, at the Toronto Star, this is a pandemic.
Yes. Hello again. As we continue this engaging conversation about the things that concern healthcare, nursing Ontarians, let me introduce to you Marit Stiles, leader of the official opposition, Ontario New Democratic Party, MPP Davenport. Marit Stiles is the new leader of the Ontario's New Democrats and leader of the opposition, of the official opposition. She has been the member of provincial parliament for Davenport since 2018. Prior to this, she represented the area as public school trustee. Prior to becoming leader, MPP Stiles served as education critic for the official opposition, partnering with education workers and parents to protect public education. Before entering elected office, she fought to strengthen Canada's arts sector and stood up for cultural sector workers. Born and raised in Newfoundland, MPP Stiles moved to Ontario to study. She lives in Toronto with her partner Jordan, where they have raised their 2 daughters. Once again.
Good afternoon. Hello. And thank you, Dr. Holloway, for that wonderful introduction. I really appreciate it. It is great to be here with all of you this afternoon. I got to tell you, I was listening very intently to a little bit of the questions there. I think you guys got better answers than I did in question period today. Can I just say? What is your secret? What is your secret? What is your secret? Anyways, I want to acknowledge also Doris for all your work. Thank you so much for being such an extraordinary champion for public health care. And folks, I want to tell you, I just came in, before I came here, I was out on the lawn at Queen's Park with the folks from the Ontario Nurses Association. Yeah. And I hear the Conservative government every day talk about the crisis that we have in healthcare. There's no question. We know it. But we also know that it is a staffing crisis, right? And that it is a crisis that was manufactured by governments that failed to properly invest in healthcare. A crisis by design, I'd like to say. And we know that a major part of that is the suppression of healthcare worker wages and nurses' wages. Yeah, and I was really pleased to stand up there with the nurses today and other healthcare workers to really call on the government to stop fighting in court to suppress those wages. We have to stop this. Yeah, thank you. I also want to say, you know, the government will talk a lot, and, you know, you heard a lot of what they had to say today, this afternoon, but they talk a lot about this need to open up our public health care system to this new bill, these for-profit, investor-driven clinics. And for us in the NDP, I mean, obviously, we are the party of Tommy Douglas. We are the party of Medicare. I will never stop fighting to preserve public health care in this country and in this province. And I thank you. And I really believe, we've tried talking about it in many different ways, and I know you're all struggling with this too. We know that people are hurting, right? We know that this government has picked this moment for a reason, and it's because people are really struggling to access health care. And what's really frustrating, and I know it's frustrating to you as well, is to see the government sitting on, swimming in cash that they are failing to actually invest in the things they're supposed to be investing it in. $6.4 billion. This was released yesterday by the Financial Accountability Office. $6.4 billion in money that has been allocated to healthcare and education and infrastructure and all of those things that everybody talks about us needing so desperately. But they're not flowing. Why? The government is swimming in cash, and they're being absolutely irresponsible by not investing those dollars right now. We could go a long way to solving some of this crisis if they would invest those dollars. So I know that you're out here, and I really appreciate the work you do every lobby day to connect with MPPs, to connect with decision makers, and to bring the stories from the front line forward. I know from experience, having been in this world for a while, that those stories are critical, right? They're critical to bringing that human face to government. When I get up in the legislature, and amazing colleagues in the official opposition NDP. And can I just say, we're very fortunate to have such a strong team of leaders who come from all corners of this province. And they've been bringing forward those stories from their communities. I was just talking to somebody about the 12,000 kids that are waiting for pediatric surgeries, right? I think it's, just if I get this right, the children's hospitals have asked for, I think, $321 million to help address that immediately. The government is sitting on $6.4 billion. What's the problem? Why can't we flow those dollars right away? So bringing those individual stories of real people, of patients, of nurses, of people on the front line, really drives it home for the government and makes it a whole lot harder for them to turn around and say no can do. Right? So very, very important. And I want to thank you again for doing that and bringing those important stories to the forefront. Our vision in the NDP official opposition has always been focused on building and supporting staff. We know that that is not only that the suppression of wages and that this is a staffing crisis and that is the heart of what's going on right now, but also it's critical to how we continue to innovate and build a future in this province. You heard the ministers talk here a few minutes ago about all those new people that are coming to our province, all of that need to develop on an economic level. We know that one of the major incentives for companies to come and build and create jobs in this province versus going to, say, the United States is our strong public healthcare system. So you mess with that, there are no jobs, right? You mess with that, there is no housing, right? There's no housing that's going to be built. There won't be any need for it. We really need to address that fundamental issue. And I wanted to share another little thing, which is just over the last few weeks ago, I was visiting, for those of you from Toronto, the former mayor of Toronto, David Miller, great guy. And I was over at his house talking to him about, the challenges ahead. I just kind of stepped into this role. And as I was leaving, he came downstairs with this thing in his hands. And it was, I wish I had brought it today. It's a tartan tie. And I said, David, not really my style, but interesting. And what it was is it was Tommy Douglas's tie. And and somebody had given it to him years ago when he became mayor of the city of Toronto and sort of said, like, this seems like it belongs with you. And it was a guy who'd acquired it somehow at an event. And I've been sitting there in the legislature every day that we ask questions about healthcare with that sitting on my desk. Because I think it's really important to remember what's at stake. That this tweaking around the edges and this sense that the government's trying to present that this is only we're just tinkering a little for right now. And that this, just because you pay with your OHIP card and not a credit card, makes this okay, really doesn't get to the heart of the issue. We know that what's going to happen is that as soon as those clinics open up and they can pay higher wages and they can offer better shifts, that more and more of our nurses and other healthcare workers in the public healthcare system are going to be dragged out of that system, and the people who need the complex care the most are the ones who will be left behind. And that is unacceptable. That is not the Ontario that I want for my daughters. It's not the Ontario I want for my grandchildren. I know it's not the Ontario you want. And so I really do feel that this right now is the fight of a generation. And thank you. And no matter what the government says, they will tell us over and over again about how many new nurses they're bringing in. We know, the proof is in the pudding. It ain't happening. We're not seeing it. We're not seeing the work that needs to be done to bring in new internationally trained professional nurses. We're not seeing the support that RPNs need to become RNs. We're not seeing the upskilling of staff that we need to support them to level up. And we are not seeing, again, the increased wages and improved working conditions that are going to keep and retain nurses in our public workplaces. So I'm going to leave it there because I know you all have a lot of questions, and I want to try my best to answer them. But I mean, I know we all talk, and you know, during the pandemic, and certainly today still, the government is quick to stand up and say, our healthcare heroes, those angels in our hospitals. But I like to call them out for that, because we know how critical you are to our province and to our future. But we need a government that's going to respect you and is actually going to take the action that we need today. And I want to assure you, I will continue to fight for that. Thank you very much.
So, the new leader of the NDP wanted a new way of doing things, and we obliged, because I think it's fantastic, which was a conversation. So I'm going to throw the first question, and then you guys build on whichever question you have. And it's a difficult one, because you made me reflect as you were talking, and because I was speaking with colleagues about the fight of a generation in terms of sustaining and ensuring that we have, let's say, even in 10 years, a publicly funded health system, because the issue of not-for-profit delivery will erode the publicly funding too. So here is my question. It's not about nursing or nurses. How do you explain, because I can't, otherwise I wouldn't be asking, that there is not an uproar amongst the public? How is it a pandemic that has exhausted everybody? What's happening in this country, because this is happening in other jurisdictions in Canada, that people are not up in arms with this issue of eroding the publicly funded system of Canada and of Ontario?
Well, really good question. I mean, I'll start by saying that one of the main reasons that I decided to run for the leadership of the official opposition NDP in the summer was because I was so upset about the low voter turnout in the last election. And I think this is related. And my theory about it, you know, I'm not sure I have the answer to all of it, but my theory is that people in this province, and I think in the country to some extent too, have been told for too long that this is as good as it gets. You know, that their expectations are so low of government, of politicians, and you know, I think as political leaders, we have a responsibility to change that. I mean, I really do. I think it's important that we are out there proposing solutions, you know, proving that we can be accountable, that you can trust us, that we're not all going to, I was going to say something mean. I won't say it. But, you know, we're not all beholden to the rich developers, let's just say, you know, that they can trust us. And I think that's really important. But generally, so linked to that, I mean, I think that we've seen, and I'm not going to just blame this government, actually. I'm going to say that over decades now, we've seen this chipping away at our public health care system to the point, and also a failure to keep up, right? Just a failure to keep up. And so, and I would say too, the federal health care agreement, to me, that's status quo. So it's welcome, but it doesn't really get us anywhere else. It just keeps things the way they are, maybe. And so people are desperate, right? People are desperate. I'm going to London tomorrow. 65,000 people in the London and Middlesex region don't have access to a family doctor or family health team of any kind. And we know that the solution is family health teams, nurse practitioner-led. You know, we know what the solutions are. The solutions are there. The answers are there. Why don't governments act fast enough? And they'll tell you, well, we've got to wait. We want to do it properly. We have to make sure it's equitable. Oh, but come on, right? People are desperate. And that's why when I talk about a manufactured crisis. I really believe that's what we're looking at. And the answer to that manufactured crisis is to open the door to the private sector, in particular to profit. And so that is why I think where we're at. And I think the reason people are not in an uproar is because two things. One is I think they're so desperate. And the other is that I think the government has succeeded in convincing people to some extent that as long as it doesn't have to be paid for out of their pocket immediately, it's okay. And I mean, let's be clear, you and I have talked about this. There are not-for-profit clinics providing important care right out there right now. But we know that the concern is that we are going to see upselling. We are going to see poaching of workers from the public system. Nothing actually gets us to a place where the public system is provided with the support that it needs.
Thank you very much. I will, at the end, I will follow up with another on the same topic, but Janet and Paula was first, and I cannot see who is in the middle there, but you go next. Okay, and then Sharon. I think Paula, you are first. You go. No, you go, girl.
First, I'm second. Thank
you. Okay, Paula was first. You guys know the order. Take the order.
Can you hear me? Good. First of all, congratulations. And I hate to say this, but the NDP had their hand in some of this mess. So I thank you for that, because I had the social contract days, and that was not so good. But here's the thing. The word crisis has been bounced around today. And there's a Chinese proverb about crisis. It means danger and opportunity. Microphone. Crisis has two meanings: danger and innovation. Opportunity. So whenever people are using that word crisis, I'm thinking about the pandemic. That was a crisis. We pivoted. And here we are, we need to do some major pivoting, because there are gaps in our healthcare system. Yet, for that matter, don't have a healthcare system. We have a disease management. We wait till people have a disease, and then we're managing them. So we really need to know what we're in the business of. And I want to put a shout out to all the nurses covering for us today out in the province, so we could be here at Queen's Park. And we thank the nurses out on the front lawn that are also doing their protesting, because we're doing our protesting inside here. And that's so key there too. So my question to you is, these transfer payments are coming from the federal government. Would you have liked to see conditions like the redoing of the Canada Health Act?
Yes, is my short answer. Yeah, absolutely. Like I said, and first of all, thank you for your comments. Absolutely. I wish I've been saying this. I think that that transfer payment should include conditions, absolutely, as well as greater transparency and transparency and accountability measures. I'm waiting to see what more details come out about it, but as I said earlier, I really do believe that when you look at the amount that we're getting, it is status quo. So it's welcome, but it doesn't really get us far enough. And absolutely, I'll say I was really disappointed originally when the Prime Minister seemed to be saying that he thought that what was going on in Ontario was consistent with the Canada Health Act. You know what? If that's their version of the Canada Health Act, it ain't my version of what Medicare is, and I think we have a bigger problem across this country. We're not alone in Ontario, but I will say that out in BC, where there is an NDP government there, they're busy buying back these private for-profit clinics, bringing them back into the public health care system.
One follow-up, if I may, just quick. Just one quick little one. My understanding is there's more people leaving Ontario than actually coming in because they can't afford housing in Ontario. So we have a bit of a brain drain going on here, and that's not good either. Any thoughts about that?
Yeah, I mean, I've seen some of those numbers, and it's really concerning. I also, of course, see that a lot of healthcare workers are leaving. And so when the province talks about making this, I mean, this is my other concern, is we're just all poaching from each other at this point, right? And I mean, that's not a game where anybody really wins, so I'm really concerned about it. And I think, again, be cautious about what the government members say when they say, well, we have to change these things and we have to build these houses for all those newcomers that are coming. And I heard the question about the Greenbelt and Bill 23. That is not about building affordable housing. That is about building big mansions in urban sprawl on ecosystems which we need to preserve, and important farmland. And thank you for your question.
Alrighty, sorry, I'm a little too tall for this. Okay, can everyone hear me okay? Alrighty, so my name is Erica. I am from the Middlesex Elgin chapter, so I look forward to seeing you on Saturday. So the question I wanted to pose was brought to me by many of the nurses who reside within my chapter, particularly nurses who are around my age who graduated in 2020 or later. Many of them have come to me with stories saying that from 2020 onward, they have been newly diagnosed with anxiety, depression, post-traumatic stress disorder, and have even attempted suicide, all because of the nature of their jobs and the immense stress that they are facing at work. In 2021, we have even lost one of our own to suicide, Stephanie Van Nguyen, rest in peace. And we just wanted to reaffirm the commitment of the NDP to do everything they can to fight for the psychological and the physical safety at nurses in the workplace, because that is part of retention, and a bed without a nurse is just a really darn expensive piece of furniture.
Thank you. Thank you, and thank you so much for that. And it reminds me that I didn't mention in my speech, and I meant to, that France Jelina, our amazing healthcare critic, couldn't be here today. She's away. But I know she would want me to mention, I wrote it down here, her bill that attempts to hold employers accountable for violence and discrimination against any nurse or staff that has experienced that in the workplace, which would go a long way. But also, I mean, again, this goes back to the current staffing crisis, the lack of support, the lack of investment on the front line. The need to hire more nurses is also so that we don't have nurses left alone providing care. We need to increase that nurse to patient ratio and make sure that it's safe and manageable, and make sure that you all have the supports you need also to get the healthcare and mental health care support that you need on the job. So thank you so much.
Thank you.
Yeah. And can I also just, yeah.
Hi, my name is Shannon Clausen. I'm a nurse practitioner. I'm the chair of the Nurse Practitioner Interest Group, and I'm here to tell you about when you're talking about privatization in healthcare, right? Can I take my mask off so I can talk clear? So we have nurse practitioners who are eager. We have these two clinics who have already had proposals in for over a year, eager to get started. And they've been faced with people saying, well, we can't afford it. We just did the numbers. If we were going to turn their clinics into a private clinic, it would cost $575 per patient per year. $575 per patient per year. So there's an option. These nurse practitioners can open up a private clinic, charge a $47 a month membership fee, and provide the care, or the province can give the funding, $575 per person per year. It doesn't seem like an awful lot. And there's a lot of nurse practitioners who are thinking that the only way they can do this is to do it independently, privately. And I personally would hate to see that happen more than it already is, because it's already happening, because there's no funding for nurse practitioners to practice in primary care.
Right, thank you for that. And I know, in the news just last week, there was the pediatrician here in Toronto who was charging to allow patients to see a nurse practitioner. And even he said, sure, go ahead, make it public, pay for it. Absolutely, and this is where we would love to see, and we've been advocating for a long time for nurse practitioner-led clinics and healthcare, so that's publicly funded. And I just want to point out again, just this quarter, $6.4 billion that's not being spent that was allocated to healthcare. The money is there. That is not the problem. Don't let them convince you it is. I know none of you are convinced by that, but don't let them go there. And I also want to say, one of my first jobs out of university was actually working in the NDP government. And I am so proud of the accomplishment in the support for nurse practitioners that the NDP government brought about. I wish we'd been around long enough to see it take a next step and see more nurse practitioner-led clinics, yeah. And help.
Thank you so much. Thank you for giving a voice to all of those issues.
Next time.
Hi.
Thank you so much for the care and passion that you bring to us today. It's much appreciated. My name is Sue LeBeau. I am a nurse, have been for 30 years, and a nurse practitioner along the way, and also a hospital CEO. One of the most devastating things that I've seen in my career has been COVID and the intersection of that with Bill 124. And I really believe that, you know, as much as nursing is a calling, as much as it's something that we want to do, it is also a career choice. And for us to see our nurses that we proudly serve and support, dealing with the pandemic, dealing with the fears that have come with that and the stresses, the challenges that have come post-pandemic as we continue to live the lives of masking and taking the precautions that we do, and at the same time intersecting with Bill 124, which still is not accepted as being unreasonable. My question to you is, how might we work together to make sure that that bill is repealed for good, and that our nurses who work so hard every day with our patients are appropriately compensated, and that organizations who employ them have the funding to be able to compensate them so that that doesn't hurt anywhere else for patients or for our staff?
Thank you. Yeah, it is astonishing, right? And I meant to say this earlier, I can't remember that one of the previous questions, but it really occurred to me, you know, I always say, if you ever doubted that government could do big and amazing and innovative things, just look at what happened during COVID. You know, every person in this country just about got a living wage for a period of time, but we can't do universal basic income? I mean, come on, right? So at very least, you know, and then not only that, but to use that and that moment as an excuse when we knew they didn't need to suppress nurses' wages and other workers of the public sector is outrageous. It continues to be outrageous. And the fact that they are appealing it in the courts, we are raising it almost every day in the legislature, and we will continue to do that. You can be darn sure. In fact, today the government said to us, tried to intimidate us in the legislature by saying that we shouldn't be out there protesting in front of healthcare facilities. And I said, we are never going to stop standing with healthcare workers in front of healthcare facilities. So take that and shove it. But because, you know, it's outrageous. It's outrageous. You know, you have a right to bargain, you have a right to bargain fairly, you have a right to be treated decently and to receive a decent wage. And if we're seeing, you know, cost of living increases in our groceries of like 10%, then we know the kind of wage increases that healthcare workers need and deserve. So I know they will lose again. They will keep losing. This will probably be all determined at the bargaining table in the end. But I really intend to make sure that every single one of the next 1,000 or so days between now and the next election in 2026, that everybody in this province is reminded that this government, when they had an opportunity to treat our quote-unquote healthcare heroes like real heroes with respect, they chose instead to tread on you. And I'm going to make sure that they don't forget it and that we elect a new government in 3.5 years.
Thank you. I agree that appeal is no way to say thank you to those who were there when it was the worst. So thank you.
Yeah.
Good afternoon. I'm Edward Cruz. I'm the chair of the International Nursing Interest Group and an assistant professor from the University of Windsor. I am an IEN from the Philippines, and I have been working with IENs since 2010 in a variety of capacities. Over the last several months, different provinces have been going to the Philippines to recruit/poach the nurses of that country. Saskatchewan, in particular, is sending a second delegation. Just last week, New Brunswick came back with 200 contracts from the Philippines. Will the NDP commit to continue to enhance and sustain the supports being made available to IENs who are already in the province so that they can become nurses in our province? Thank you.
So I do want to clarify only one thing, and I will credit Araneo single-handedly for that, and this goes back to McGuinty's time, not even now, that actually at the time, years ago, also Ontario wanted to go, driven by employers. The government back then, McGuinty, sent them to talk with us because they knew that we are going to be up in arms, and it stopped. So thankfully, that has not happened in Ontario. Yet we still have, and you know Philippines is #1 on the list, India is #2. We still have, despite the progress of the College of Nurses, and by the way, I do want to introduce my colleague and friend, Dr. Karima Belgi, the Chief Nurse of Ontario. We do have still, I would say, the college says 6,000, my hunch is probably around 10,000 INs living in Ontario ready to practice. Somehow we need to continue to fast track. Karima is totally on board. Even the new CEO of the college is totally on board. But we need to fasten the processes in Ontario. All the processes we need to fasten.
Expediting internationally educated nurses to get into the field here, to be qualified more quickly. We understand and completely support it, have been pushing for that for a long time. But I hear you as well, that it's also about supporting them once they're here, right? And continuing to support them and providing the resources needed. And while we're on the topic, also continuing to listen to racialized workers in our system and their priorities. Yeah, thank you very much.
Thank you very
Good
much.
question.
So what a treat. I need to say what a treat. Now, I need to put a full disclosure, which honestly I didn't know myself, and you may not remember, but I didn't know for sure, that my husband at some point worked with you or for you on whatever initiative back in the days.
Yeah, your husband.
Yeah?
Yeah, we were working together on some, I think, international
maybe,
solidarity
who knows
stuff.
what's going on here.
Yeah.
Right, on initiatives on environment
Yes,
and
that's
other
right.
aspects.
Yeah.
Who knows?
Yep.
So I had the tip that she's worth conversing. She's really intelligent. That was the comment.
Oh, nice.
And I said, she's not only intelligent, she's passionate and committed. So thank you. Thank you for wanting to engage with nurses with questions rather than only speaking with nurses, but listening and engaging in questions. Thank you, Merit.
Thank you so much. I really appreciate it. Thank you. I appreciate it. I am pretty passionate, and I'm pretty darn competitive, and I'm not ashamed of it. And I hope you heard that today. And I'm not afraid to get political. But I really do, I really do believe that it's incumbent on us who are in positions where it's a privilege, right? It's a privilege to be in a position like I'm in, to be able to listen and to learn and to listen to the experts, which is all of you, and bring your voices into the legislature every day. So thank you again for inviting me.
So as we continue, I heard the word pivotal, which is absolutely essential. We don't want to dance around the issues. We want to have a change in direction that will help all Ontarians. So as we look forward to welcoming John Fraser, Interim Leader, Ontario Liberal Party, MPP, Ottawa South. John Fraser is the Interim Leader of the Ontario Liberal Party. He was born and raised in Elmvale Acres and Alta Vista, and has been an active volunteer in a number of local organizations and initiatives. MPP Fraser understands the challenges that businesses face, having spent 18 years managing small and medium-sized local businesses before entering public service. After the 2014 election, he was mandated to support the development of a comprehensive strategy for palliative and end-of-life care in Ontario. MPP Fraser is married to his high school sweetheart, Linda, and they have 3 grown children, Kirsten, John Jr., and James, and 3 grandchildren, Vaughn, Sloan, and Fraser. Let's have a round of applause. I will also introduce at the same time Adil Shamji, health critic, Ontario Liberal Party, MPP, Don Valley East. Dr. Adil Shamji is the Ontario's Liberal Caucus Critic for Health, Northern Development, Indigenous Affairs, and Colleges and Universities. Since graduating from Western University and completing medical school at the University of Toronto, MPP Dr. Shambi has devoted his career to helping people. After having spent his earlier years providing health care on Indigenous reserves across Canada, he most recently served as an emergency physician and the medical director for 11 homeless shelters in Ontario. In addition to his role as physician, MPP Dr. Shamji works as a faculty member in the School of Medicine at the University of Toronto. He has fought at the front lines of the COVID-19 pandemic and the opioid crisis, and looks forward to continuing his advocacy as member of Provincial Parliament for Don Valley West. Let's welcome them both again.
Good afternoon. Bios are the most embarrassing thing when you're a politician, because your staff write it and you go, but did they write that? Because there are some things that are really important that I want to tell you about me that aren't in the bio that I should have had put in. But first, bon après-midi. Je suis très fier d'être ici avec mon collègue, Dr. Adil Shamji, to be here with you. So the most important thing for today that you can remember about me, some of you already know, I am the son of a nurse. So my mother Mary worked at National Defence Medical Centre in Ottawa for 35 years. Yeah. And for 35 years, at the end of her career, she got to work on things like the short stay unit, but she wasn't forces personnel. So she never got the real opportunity till later in her career to be like a nurse manager or head nurse. Very capable, very smart and all. And I've learned lots of things from her. And I called her today before I came in here because I said, Mom, I'm going to Hamilton. We're going to have this big meeting. I'm talking to the nurses. And I say, Mom, is there anything you want me to say? And she says, I don't know what to say. She says, just welcome them. And I said, well, I hope they welcome me, Mom. That's kind of the point. And so here's two things I learned. Number one, having a nurse in every family would be a solution to our primary care challenge. Everybody gets the calls, right? Extended family, it's so true. And so we were still on call with my mom when she was like 80. And even after she'd had a stroke. So we really depended on her. And the second thing is, nurses resist care. Even at 92, with and so it's still incredible, even my mom these days. And that's because you realize that the work that you do requires you to keep working. It's to keep moving forward. It's that you don't want to stop. So I was thinking about her today when you made your presentation and we're talking about retention. It's not recruitment and retention, it's retention and recruitment, right? Because you can't build something unless you hold on to what you have. So that's the way the government has to look at it. So I asked my mom, this is a while ago, I remember this, which is surprising because I'm getting older. I said, Mom, why did you become a nurse? And this is in the 50s, she says, they paid me. She said, they paid me. My mom was a great nurse. After she graduated, I can't remember the name of the hospital in Hamilton right now, she got a scholarship to Western University in 1955. $1,500 in 1955. That was the ride back then. And what did they get for paying Mary? A minimal sum to be a nurse, and then giving her an opportunity to educate herself. They got a nurse that worked for 35 years, right? That's how you treat people. That's how you get people to stay. You get people to enjoy. They have to learn. They have to feel valued. So I want to leave some time for Adil here. I could talk for the next 15 minutes, but I wanted to tell you that we're squarely focused on that and building up our healthcare system, and I'll turn it over to Adil.
Good afternoon, everyone. I just want to start by saying how special it feels right now for me, because ever since I went on a leave of absence for my clinical work just before the election, it is very rare now for me to be in a room that is full of nurses. And that is something that is really so special to me, because nurses are my friends, they're my family. My sister's a nurse, my cousin is a nurse. They are my colleagues, and you are all integral to our healthcare system. And I really have to be on my best behavior because they were also my campaign volunteers, so. You know, there's a reason that nurses, year after year, remain the most trusted profession. It's because nurses fight for patients, full stop. They fight for the healthcare system, full stop. And so now it's time for us to fight for nurses. I was just in the media studio at Queen's Park this morning, and I was asking this government to abandon their efforts to persist with Bill 124. I was reminding them that if they are going to turn their efforts to anything, it is to addressing mental health challenges amongst our frontline healthcare workers, addressing the challenge of burnout, bringing paid sick days, and creating safer workplaces. As a politician who has had the honor of serving patients as a physician, I have had a front row seat to what nurses can offer our healthcare system and to our patients. To be entirely frank, I've had my butt saved by nurses in the emergency department, and you know that. You also heard that I had the honor of serving as medical director for 11 of our shelters here in Toronto. What the biography didn't say was that I was medical director for 11 nurse-led clinics in shelters in Toronto. And those clinics were amazing. Doris, I know today you were talking about the need for more safe supply across our province. Those 11 nurse-led clinics, I can't prove it, but I would bet on it, were collectively doing the most safe supply in the city of Toronto. When there was a job to get done, it got done by nurses. And so what I want to say today is that I really hope that you will believe that we, as the Liberal caucus, and as patients, and as Ontarians, really believe in nurses. And as I said, in the same way that you have fought for us, we will fight for you. Now, coming out of with the career in medicine, it was a huge pivot to come into politics. The one skill that came to me very quickly was be able to talk for a very long time. So I'm just going to stop now so that all of you have an opportunity to ask us questions because we're both very eager to engage with you. Thank you for being here and listening to us today.
I did want to say something about Doris, who I've known for 10 years and have had a good working relationship with. So first of all, I made sure I was early to be here, so I wasn't going to be late. I checked in this morning. It was the first time I was invited to an event. It was a BPSO event, and Doris invited me. And so that night, I spent about an hour and a half going through all the BPSOs, the executive summaries, because I wanted to know what you were doing before I got there, because I knew that I might be able to impress Doris. And it was really important to make a good first impression. I think I made an okay first impression, and you're just a tremendous advocate for the nurses that you represent, and not just the nurses, but the people that they care for. And I made sure I was early and on time, and I checked in this morning so you'd know that I was here.
Thank you, thank you, thank you, thank you. You know, in this role of mine, we become friends with politicians, and almost regardless of the political party, unless they're really obnoxious. You saw me with one that I did. It's not going to be my friend anymore, that one, but we're not. What can you do? You can't be a friend with every politician, regardless of the political party. But this guy, total, 100%. Some people, it doesn't matter if they're politician, if they're a nurse, they're just, as my mother used to say, the most decent human beings. That's one of them. That's one of them. Paul-Andre.
Paul-Andre Gauthier. I'm the president-elect of the Clinical Nurse Specialists Association of Ontario, and I'm also a PhD in nursing. I'm a doctor in nursing. So, John, thank you so much for your presentation. I'm calling you John because I know you from many years. Yes. I'm a specialist in palliative care, so I love it when you talk about palliative care also. But my colleagues today say, Paul, go to the mic again, because I was there earlier with the Minister of Health. So, the concern we have, and it's one of the about recruitment and retention of late nurses for the late career programs that we had before, that your government had. So we need to bring that back, because nurses at the bedside now are alone and not much experience. They have 1 or 2 years experience. We're lucky if there's some nurses who are older that are around. So one of the things we've been saying, and as part of the clinical nurse specialists, we're talking about having clinical nurse specialists also at the bedside to help the nurses who are young and need support, but also nurses who have a lot of experience. I have 40 years of experience in nursing, and I'm not the only one. Today, there's a colleague of mine. Where are you? Una, right there. She is over how many years? 55 years in nursing. We need nurses who can do it, who can support the nurses and mentor them. Because by mentoring and providing support, nurses will not leave, they will stay in.
Yeah, no, I thank you very much for that question. And you know, I do remember the late career nursing program that we had. And I know Una has and she works hard. It's not 55 years of, and in the job that she does, and all of your jobs. But I look back to personal experience. You know, my mom got lucky. She got to be the short stay unit coordinator last 5 years of her career, at which point she was actually needed 2 prosthetic hips, which she was refusing to get because she wanted to wait long enough so she didn't have to get it twice. And if she hadn't got that, she couldn't have been on her feet, standing on those terrazzo floors, and shoes weren't as good, 40 years ago. Sorry, I'm going down the pipe there, but we have to, it's like I say to, and I'll turn this over to Adil for an answer as well too, is I say to my kids, I say, look, you're smarter than me. And a lot of the people that are coming in, we know that they just got so much more information. But there's one thing you need to remember, and don't ever forget. I will always have more experience. And that's really important and critical when you're caring for people. Oh. You want to say something?
Yes, sure. I'm reminded of a story that one of my campaign volunteers told me. Her daughter is an ICU nurse in Scarborough. And she finished her clinical training in the middle of the pandemic. And within 1 year, she was one of the most senior people on her ICU unit. And she was preceptoring the newbies. And I know that she was and is an amazing nurse. But there's nothing to replace the experience that that a nurse who has been doing it for a long time brings to the table. When I was working in the Northwest Territories, there was one ER that I worked in that was a low volume emergency department. And the one thing that I knew, we had the most wonderful, experienced nurses. If I was in my call room and the nurse said, "I need you now," I didn't ask any questions. I didn't need the demographics. I didn't need the chief complaint. I needed to get my ass out of bed. That's what experienced nurses bring to the table, and that's what we need. That's why we need to fight so hard to create an environment that is safe and conducive to them working, still be able to contribute to our healthcare system, and to grow the next generation of nurses in this province.
Hi there. So I am a new graduate nurse who just graduated in June of 2022. My first nursing job was a public health nursing job where I was being paid $36 an hour. Recently, I was offered a community nursing position where the highest position was only willing to pay me $28 an hour, a nearly $10 pay gap for exercising the exact same scope of practice. This is a story that has been echoed by many of the community nurses under the Middlesex Elgin chapter, and they have communicated that not only do they face lower wages, but they also lack benefits that many bedside nurses have access to. We understand that the Liberal caucus is doing the best they can to fight for the repulsion of Bill 124, and we ask that you commit to not only fighting for the repulsion of that bill, but also for the equalization of wages between bedside nurses as well as our community nurses, because our community nurses are essential for keeping our patients out of the emergency department, for keeping our patients home and helping them thrive. Shout out to our community nurses out there.
So I've said it before, I'll say it again. Bill 124 needs to go.
Oh yeah.
But that has been repeated.
I'm not going to talk about Bill 124. Something way more interesting even for a minute, just for a minute, political total. You know, some people were trying to get Mike into the Liberal Party and all that jazz that was in the media, and he disagrees, not going. So I'm inviting him, just in case you get your way, I'm inviting him to sit here for a minute because he needs to wait, because we are going to leave you at least 5 more minutes because we steal time from you. Mike, come and sit. But it's not to go with the Liberal Party, eh? You stay with the Green Party, come here.
Okay. So perhaps I'll just finish where I left off. Bill 124 has to go. But the one thing that I've been saying from the very beginning, Bill 124, Bill 124 has to go, has been repeated so many times it is even beginning to lose its meaning. We can't stop saying it, and we have to remain committed to that, but we need to think beyond just Bill 124. And that's where some of the other things I was talking about come in, making sure we have safe workplaces, protecting against mental health challenges and burnout, and those kinds of things. But you touched on something that is very important, which is ensuring that we have parity in wages between the acute care sector, the long-term care sector, and the community and home care as well. Because, and nobody can be blamed for this, for as long as we incentivize people to work in acute care, that's where the patients will go too, because they can't get the care there. They can't get care anywhere else. And we know that there is better care, more dignified care, more accessible care that is offered in the home, in the community, in long-term care homes. And so we need to make sure that we support our staff and our healthcare workers to be well paid to work everywhere. That is the fair thing to do, and it's just better healthcare.
Thank you.
Thank you so much. My name is Rachel Elliott. I am a registered nurse. I teach
a lecturer at the University of Windsor, and during the pandemic, I went back to work at the bedside. So many of us are balancing multiple roles in our professions, going back to school, working part-time at the bedside, trying to afford role changes or different changes within our profession. Rebecca is the president of the Nursing Students Association of Ontario. She brought up a great point today about how so many students, nurse practitioner students, are struggling with paid clinicals or the lack of paid clinicals for all the hours that we are required to do to be able to change the different type of registration that we would want to have. I'm such a passionate educator and I want to create a better workforce for my students. The rate of burnout is less than 2 years now. So the stay-at-home grant, it's great, but it doesn't really support retention. It doesn't support the mental health and well-being. It doesn't ensure safe staffing, and it doesn't really help to create safe placements and mentorship and matching that experience for what our students need to be able to practice safely and effectively here in Ontario. So my question is, will you work with the nursing students of Ontario to hold the government accountable, to really think about ways that we can be creative about supporting students in their clinical placements, to be able to recognize nurse practitioners, to be paid for their placements, and to be able to think creatively to try to avoid burnout as we are working so hard in public health care? Thank you.
Thank you very much for that question. And yes, 100%. You know, the story that I told you about my mom and how she became a nurse for 35 years, it wasn't an accident. It was a result of the government making investment in her, the VON at the time making an investment in her. And so, you know, there's another story I have about a long-term care home in Ottawa I visited about 7 years ago. And it's not particularly about nurse education, but it's about education. They were a private, for-profit company. And they had a scholarship that was $500. Anybody could have it, as long as you took it. And they backfilled. They supported whoever went and made sure that it didn't come up short, right? And that people were supported in doing that, and that the people working there. And actually not just when people are getting education in a way, but also when there was a problem at that long-term care home, and Una would know about this, is that the most important thing were the needs of the residents and the needs of the people who were helping them. So you weren't going to be in an office. You were going to be helping somebody get dressed or feed somebody. And so if we want to retain people and recruit them, we have to pay them. And then we have to make sure that they know that we value what they do. And we do that by investing in people. And that's in respect, but it's money and it costs. And it just like it cost in 1955 to pay a nurse to be educated, why is it any different in 2023? You know, and that's when we needed nurses. We need a lot of nurses because there were a lot of babies coming on. So, thank you.
Thank you. Rebecca?
Can I just add something really quickly? Just on top of that.
And that's the last one. Rebecca is the last one question, please. Just alerting you because we have here Mike Schreiner waiting. Thank you.
So hello, my name is Rebecca. I'm the president of the Nursing Students of Ontario. I just wanted to raise a concern that I know another student, Mackenzie, had, and she raised it in a past meeting. It's just the disparity of the clinical placements within schooling. So coming out and hearing that, sorry, I feel like you can't hear me. Coming out and hearing that the most senior nurse in an ICU only has 1 year experience, that's terrifying for me because I only have 1 placement experience coming out into graduation. So the pandemic really had an impact on what placements were available and what nursing students could experience. I know as a doctor, I'm sure you can attest to having rotations and trying different things and knowing what you're passionate about. And as a student, I feel like we weren't necessarily given that opportunity with the pandemic. So I'm just wondering if there's anything in the works of standing next to students and making sure that these placements are kind of standardized through all schools so everyone has the experience to try and figure out what they want to kind of go into. Thank you.
Yeah, thank you very much for sharing that. I do absolutely remember the challenge of finishing second year medical school and thinking, I've got, technically I have 2 years of clerkship rotations, but I got to have my research and my applications and reference letters already within the next 6 months. So really, how much selection and how much time do I have to choose? My sister, she's an ER nurse now, but when she went to Western and she was doing her nursing education, her clinical placements as well. I mean, I remember her I recall her only talking about one placement. It was NICU. She loved it, but she could have loved many other things as well. And ultimately, she settled on emergency medicine, and she's an Ontario poison specialist now and all that kind of stuff too. But it's been a long and circuitous route for her to get there. And when our nurses are investing so much of themselves to get to a position where they can support our healthcare system, then we need to invest in them too. And we need to, and honestly, finding the roles and the positions and the placements in which nurses find the greatest fulfillment should also be a vital part of the strategy to retaining nurses in our healthcare system for as long as possible. So the right thing to do, we can also be transparent, is also a selfish thing to do, but can support our healthcare system for everyone. So there's so much merit in what you have to say. I'm going to have to learn more about that because my sister graduated many years ago. But I really appreciate your comments so much.
Hello. One more. My name is Kathy Moreland. I'm a registered nurse with 40 years experience. I'm also the Waterloo chapter president. The opioid crisis has not been mentioned much this afternoon. There are 7 people a day dying in this province of drug poisoning, and about 2,700 people died last year in this province. And I'm just wondering if you could comment on the Liberal caucus's position on harm reduction, please.
Deal will go, but 100% supported of safe consumption sites, have been since square one, since being in government. It is a crisis, and we have to address it with the tools that we have. But Adil has hands-on experience with this, so I'll let him say a few words.
I really appreciate you asking that question, just because it is something that we need to be talking very explicitly about. I've often said that during the pandemic, really we dealt with 2 parallel epidemics. We had the challenge of COVID-19 and we had the challenge of the opioid crisis. And there were times in some of the shelters that I was helping at, it was so apparent that the isolation that was essential to staying safe from COVID was also the same isolation that was obliterating the support networks for people with substance use challenges, and was one of the fundamental reasons that they were overdosing and nobody was noticing. So we do have that parallel epidemic. And I cannot say how passionate I am about making sure that we never forget that the opioid crisis is here. It's never gone away. And honestly, it is something that crosses all political stripes. It crosses urban and rural divides, NDP, Liberal, Conservative, every single one, rich and poor. Of course, I support harm reduction. As I mentioned, I was proud to serve as medical director for the 11 clinics in the city that I think were providing more safe supply than anybody else. We also had the lion's share of the safe consumption sites in the city as well. I'm proud of the work that those nurses were doing. I'm proud of the role that I was able to play in supporting those nurses in doing that work. And I will never stop being an advocate for this challenge. And neither will our caucus.
Thank you very much. And I would also ask that you continue to lobby for a full harm reduction spectrum with the current sitting government, because they believe that treatment is the only answer. And we all know that construction workers and recreational users are also dropping. So there is a lot of misinformation about safe supply that's out there in our current government, and I would really appreciate it if you continue to have those discussions. Thank you very much.
I won't stop. We won't stop.
One quick shameless plug, and I checked it with Mike, but I first want to say you have to keep people alive before you can help them overcome the disease that they have. I am really proud of our caucus, proud of Adil. I know there's 8 of us. We also had a great group of candidates that was really incredible. And we had, I think, half a dozen nurses, a few doctors. Marjan is here. She was one of them. It was the hardest thing. It was a hard election. If you look inside, there are good things that are there, but it's hard to see when there's 8 seats. We beat the NDP in popular vote. We just didn't get them in the right places. The hardest thing on election day for me was to see the people who I knew, like Dr. Nathan Saul, like Marjan, people who are committed to healthcare, who joined us, really great people, that they weren't successful. because I know what they believe in and that they believed, and I was really proud of them. And I remember the first time I walked in the room and saw all of them together. I was just like, wow, I'm so old, but this is so great. They believe. And so that belief's still there. We're going to get together in Hamilton this weekend, and there'll be lots of nurses and doctors and teachers and moms and dads. And I want to thank you for your attention and thank for the invite. Sorry, I had to get that changed. I'm a little. Thanks.
We will meet. Wait. Venga, Madam Presidenta, come on. Morgan.
Mask. Oh, yeah. Mask.
Mask, yes.
Mask. That's what they said.
Yes.
I just heard a loud noise.
Yes. I don't even know if it's in the right way, but yes. We will get in touch. Yeah. For me, please. I know, but I think that's what happened. Yes. Okay, Madam Presidenta.
Last but not least, Mike Schreiner, leader, Ontario Green Party, MPP for Guelph. Mike Schreiner is the leader of the Ontario Green Party. He was elected in 2018 provincial election with a resounding 45% of the vote as the party won its first seat at Queen's Park. MPP Schreiner was elected to the Ontario Green Party on November 14, 2009. Under his leadership, the party has experienced substantial growth in its voters, fundraising, staff, volunteers, and media exposure, reaching its highest support levels in the 2018 election. A successful entrepreneur and small business owner, he is a leading advocate for small businesses, local food, and sustainable communities. Family and community are important to MPP Schreiner, who enjoys spending time with his wife Sandy and their 2 daughters. Welcome.
Thanks, Claudia, for that really kind introduction. And I just want to say how wonderful it is to join RNAO in person again this year. I always enjoy my time with you, and I want to begin by acknowledging that today I want to express my gratitude for the opportunity to meet on the traditional lands of the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, in the treaty lands of the Mississaugas of the Credit First Nation. And I'm grateful for what I've learned from Indigenous peoples about how to be a good steward of the land and the water, the animals, the plants, and the people who live here. And I want to reaffirm the Ontario Green Party's commitment to the truth and reconciliation process. I want to thank you for the opportunity to be here today. Claudia, I just want to say, thank you for your role as president. And of course, Doris, you're a force of nature, I tell everyone, and do such an amazing job as CEO, just advocating for people in this province. One of the things, and I want to begin by saying one of the things that I most admire about the work that RNAO does is your commitment and your perspective around the fact that healthcare and the ability to care for people is rooted in systemic issues. And you look at those systemic issues and root causes of why people are healthy and are not healthy. And you know better than anyone that a healthy Ontario is an Ontario where we address the systemic barriers that prevent people from accessing the care and services they need. Barriers like poverty, poor air quality, homelessness, systemic racism, and gender-based discrimination. And overcoming these barriers means investing in solutions that put people first by addressing the social and environmental determinants of health. Solutions like affordable, accessible mental health services, expanding them to make them available under OHIP. Solutions like ensuring that everyone in Ontario has a safe and affordable place to call home. Solutions like ending legislated poverty by doubling social assistance rates. Solutions like building affordable, connected, sustainable communities where people can live close to where they want to work and shop and spend time from their family and access the services like healthcare and education that they need, where they're not forced into long, expensive, anxiety-inducing commutes. Communities where we protect nature, where we protect the farmland that feeds us, and the wetlands and the green space that clean our drinking water and protect us from flooding. Communities where we reduce climate pollution and we ensure that people, and especially our children and grandchildren, have a stable, livable climate. And solutions like paying workers fair wages and ensuring that they have access to permanent paid sick days, so nobody has to choose between going to work and putting food on the table and staying home when they're sick. So we know, and I know you know, that addressing the social and environmental determinants of health are critical to having a healthy Ontario and taking pressure off of our healthcare system. With that being said, I want to be absolutely clear that we need a provincial government who is going to invest in our public healthcare system. Investments that will expand and reform Ontario's healthcare system. More investments to improve primary health care, team-based community care, nurse practitioner-led clinics, expanded scope of practice for nurses across the spectrum, investments in better home and community care, investments to increase long-term care to homes for the elders in our community, investments that not only expand the hours of care, but also nursing ratios within our long-term care homes. Investments that declare the opioid epidemic as a public health crisis and to expand harm reduction and safe supply as well as treatment options. But unfortunately, yeah, please. Most of you know I don't get too partisan, but I'm going to say, but unfortunately, despite the fact that you and other healthcare experts have told this to our provincial government, the current government, over and over again, they all too often deny the facts and the evidence on the ground. Yeah, absolutely. And they refuse to acknowledge that at the root causes of the healthcare crisis we're facing in Ontario right now are nurses, frontline staff, and doctors who are overworked, underpaid, and disrespected. And so I want to be clear that Greens stand with RNAO in calling on this government to end its appeal of the illegal Bill 124, which was restraining your wages and leading so many nurses and frontline workers to leave our healthcare system. We will work with you to embrace the opportunities outlined in the nursing career pathways, working with you to implement those opportunities in Ontario. Greens also stand with you in opposing Bill 60, which opens the door to more for-profit private healthcare clinics in this province. You know, the government calls it the Your Health Act. I actually think they need to rename that title, because let's be clear, our healthcare system was built by the people of Ontario, paid for by the people of Ontario, to focus on caring for the people of Ontario, not to line the pockets of investor, shareholder, capital corporations. I want my tax dollars and your tax dollars to go to line the pockets of the people who care for my loved ones, my neighbors, and the people in our communities, not outside investors, not putting patient care first. So everyone in this room, and this is what I don't understand what the government doesn't get. Everyone in this room knows that the backbone of our healthcare system are our nurses and frontline healthcare workers, and that they deserve to be cared for in the same way that our patients and family members deserve to be cared for, because there is a direct connection between your wages, your benefits, your working conditions, and the quality of care the people in this province experience. And so we know that private for-profit healthcare clinics are only going to make the staffing shortage worse. It's only going to drain people and financial resources from our healthcare system. And so I want to say that Doug Ford might call this innovation. I call it actually taking the steps to destroying a healthcare system we as a province collectively have built together. And I will stand with you to defend that system, the publicly funded, publicly delivered healthcare system that so many people across this province and across this country are so proud of. And so I want to close. I want to close by saying that almost every public opinion survey I've ever seen has nurses at the top of the list. I'll admit politicians are usually at the bottom, unfortunately, and maybe it's well-deserved. But nurses are at the top of the list. And during the pandemic, you were called heroes. And I just want you to know that in my mind, you've always been heroes. And you will always be heroes. And you deserve a government that's going to respect you and pay you and provide you with the working conditions that heroes deserve. Okay, I wanted to make sure I left some time for questions because I was enjoying the last Q&A. So happy to take any questions. Yeah, absolutely.
If there's nobody going, I'm going. Paul-André Gauthier, I'm president-elect of the Clinical Nurse Specialists and past president of the RNIG. So a few years ago, Mike, I told you that you should be a friend of nursing, but you should be an honorary nurse working with us because you know how to do it and put it together and make sense out of it. Thank you so much for your interest, your dynamism, and the passion that you have for healthcare. We need more of you.
Oh, thank you. I'll get your question in a second. I just want to read it. So part of what drives me is that I think the foundation of our society is care. Care for each other, care for our planet, care for our communities, care for our most vulnerable neighbors. And one of the things I love about the policy work that the RNAO does, and Doris, I know, deserves so much credit for this, is it's centered on care in the broadest definition possible. And so the fact that you spend so much time talking about the social and environmental determinants of health, and you make those direct connections to how it affects our healthcare system and the health of the people of our province, I find inspiring, and that's why one of the reasons I love working with all of you, and would be happy to be considered an honorary RNAO member.
Go for it.
Cyrus, a University of Toronto nursing student. My question for you is, how can you build trust with nurses, and what do you think the government can do to prevent a two-tiered system?
Yeah, so how to build trust with nurses, I would say actually meet with nurses, listen to what nurses have to say, and follow the expert evidence-based decisions and policy proposals that nurses put forward. And I believe one of the most egregious examples of that is, and I'm going to get the numbers wrong, Doris, so correct me if I'm wrong, I believe it was 30 reports over 25 years on how to actually build long-term care homes that cared for our elders. And the fact that so many successive governments ignored the advice of RNAO and others who told us how to build a long-term care system that put patient-centered care at the forefront, was so exposed during the pandemic. And it's something that I think we collectively need to be held accountable for, and we owe it to our elders and to future generations to fix it. Did I get the numbers right, Doris? I got those numbers right? Okay.
Lori Webble-Edgar, and I'm from Region 5. I just wanted to share a story about my experience with compensation. I have over 35 years of experience as a nurse, and during the pandemic, I decided to work on the weekends in our clinics to give immunizations. Yeah. And I was offered the starting wage of an RN to work extra time, and I found it very insulting as a nurse with this much experience to be offered $35 an hour and sit beside my physician colleagues who are making $250 an hour to give injections.
Yep. I hear you.
I very much admire your passion and your willingness to accept our evidence-based reports, but how do we get some of that out into our local Ontarians and to other potential candidates for your party?
Mm-hmm. Yeah, that's a great question. So I think one of the things that we need to do more of is to have days like today where we're having conversations, we're talking about the reports you're putting forward, the expert advice you're putting forward, and then it's incumbent upon us as politicians to make sure that we do everything we can to amplify the expert and evidence-based advice you're providing. If I could just quickly talk on wages. So I'm a strong supporter of wage parity across all sectors and professions. The fact that people in acute care are paid more than long-term care or primary care is wrong. And I'm also disappointed and frankly outraged at how many nurses came to me, especially during the pandemic, who were upset about the $5,000 bonus in the first place, because it's like, pay us a real wage that actually is going to be permanent and is going to be part of our pension, et cetera, et cetera. But I can't tell you how many nurses who came to me and said they didn't even qualify for the bonus because of little
Yeah.
technical definitions around what the government considered a nursing practice and not a nursing practice. And as far as I'm concerned, a nurse is a nurse is a nurse. You deserve compensation, you deserve fair wages and fair benefits, and it shouldn't be the government defining like which nurse qualifies and which doesn't.
Yeah, at the end of the day, I think I actually paid more money to work extra
Probably.
than I earned.
Yeah, exactly.
yeah.
And thank you for doing that, but it's not right.
Yeah.
Yeah. Yeah, go ahead.
Hi, my name is Donna Lawrence. I'm a master's prepared nurse who's a director of care in long-term care.
Okay.
I wanted to thank you for acknowledging how the government does not really speak to what's actually happening in long-term care. I also want to thank you for acknowledging RNAO's position of the long-standing issues in long-term care that were exacerbated by the pandemic. And then I just want to make some comments about what I actually see. So I see a staffing crisis that worsens almost every single day. So at my home, I have 150 staff, but I also have 38 vacant PSW lines, 15 vacant RPN lines, and it just keeps getting worse. Our demographic is like ages 30 to 105. The applications coming into long-term care are residents that have severe psychiatric issues, to which the education, the knowledge, and expertise to handle mental health issues in long-term care is next to impossible. Yet we're forced to take these people, and my staff are getting beat up, they're stressed, and they are starting to have their own mental health issues with PTSD. And so I would like at least that acknowledge that the infrastructure that we have for long-term care really needs to be torn down and rebuilt, so that way there is a manageable system and that it is a sector that people actually want to go to work. Thank you.
I hear you. Can I just say one, thank you for the work you do and the passion you clearly bring to that work and your advocacy for your nursing and non-nursing staff. Some of the hardest calls that I receive in my constituency office are from nurses who tell me that they stay up at night worried that one of the patients they're caring for, whether it's in long-term care, acute care, most of the time, oftentimes in long-term care and acute care, that if they're going to die on their watch, because people are so overworked and stressed out, and there's so many vacant positions that are not being filled. And I just want to acknowledge how much each and every one of you go above and beyond the call of duty, and have now for a number of years, pre-pandemic, but especially during the pandemic, and now with the staffing crisis we're facing in this later stage of the pandemic. And I, as a politician, will remain committed to continue to advocate and push and do whatever I can, and to work across party lines with the other opposition parties, and to work with government where we can to address the real deep and systemic challenges we face when it comes to health human resources, and especially when it comes to long-term care. And I want to be clear that it's not only that we need a standard of care of 4 hours, which is something many of us have been pushing for a long time, but we also need to make sure we have proper nurse ratios as well. So it's not only 4 hours of care, but it's also making sure we have the right expertise in place to guide that care.
Today during question period about Bill 60 and the piece around profitizing not-for-profit care. As I'm sure you know, RNAO is very supportive of our publicly funded not-for-profit healthcare sector. And I was hoping you could comment on what you will do as an MPP and what you would recommend we do as nurses to really help the public understand that, yes, although you can go and pay with your OHIP card and not your credit card, how those clinics are eroding our publicly funded not-for-profit healthcare system.
Yeah. So I've been trying to do a couple things with this, and maybe this is my background as a small business owner, but in addition to talking about the staffing challenges and the way that for-profit clinics are going to make the staffing challenges worse, I've also been saying that I actually think it's bad business practices by the province, and it's completely fiscally irresponsible for us to not fully and efficiently utilize the existing built capacity in our healthcare system that we've already paid for. So the fact that so many public surgery clinics are sitting idle or not being used to full capacity because of lack of staffing, like, why would you then pay more money to go over and put money into private for-profit clinics when you've already paid for spaces that, if we just had properly funded and compensated staff, could actually reduce the backlog? So I've shifted some of my public commentary to try to actually push back that not only is this an erosion, like from an ideological standpoint, it's an erosion of public health care, but from just a fiscal standpoint and a good business management practice standpoint, it makes absolutely no sense. So I would think that people across the ideological spectrum should be opposed to these for-profit clinics because they're not even fiscally responsible as well. Yeah. There you go. Doris is going to give me the hook, so I'm sorry.
No, well, you are in for a surprise. You are in for a surprise. So was Merit. You are in for a surprise. Same player, my husband. You can let him know at the AGM that whatever he does that doesn't fit the script, he gets in trouble with you guys. That will help. So let me start because that's the easy one. So I had an important birthday this year, like 20. And my husband, unbeknown to me, decided to go to whoever he thinks are my friends. And the party was only with the family, but they exposed me to videos that I'm still watching because it's like 70 hours and I don't have 70 hours. But one of those videos, I'm sure you know about this, I have no idea how that happened, was Mike Schreiner. And of course, much to my horror, instead of happiness, I go, Mike Schreiner, I'm going to get in trouble with everybody else. Mike Schreiner, why Mike Schreiner? I told my staff that at senior management. Like, where is George? Where is Dalton? Where is this? Where is that? Where is the premier that thinks he's my friend? Where is everybody? He says, Mike Schreiner is a caucus of one. But let me comment about that because he said that to me one time. You said that to me. This is why people go after Mike, whether it's my husband in my personal life or the Liberal Party that you heard me say before, that people from the Liberal Party, from the old guard leadership of the Liberal Party, that's not a small potato, went after Mike Schreiner to actually go and lead that party. And the piece you don't know also is a media reporter called me and said, so what's your bet? I said, he's not going to go. How come? Because Mike Schreiner has a person that has full integrity, and he will not go. And I think you did absolutely the right thing. Not because they would not have benefited, but because of who you are. But my gosh, we wish, and we need more nurses to run for Mike in different locations, because what a leader, eh? What a leader. Thank you. Leader that doesn't need notes to speak, and speaks from here and here in a congruent and consistent way. Thank you, Mike. Thank you. And thank you for the message you sent. I will leave you before Claudette closes with one more treat. Because it is not common that the chief nurse stays, and I think it's the right thing to do, by the way, for absolutely all the political parties. Because a chief nurse officer shouldn't work only for the party of the day. The chief nurse officer is there for the system. And Karima stay for absolutely the whole thing. So I think it's wise and it's important. And I have asked Karima if she can just bring even 5-10 minutes of greetings to you, share a little bit where she's going with us, and just enjoy her.
Good afternoon, everyone. Indeed, I am the Chief of Nursing and Professional Practice in Ontario and ADM. In no short part because of the advocacy of RNAO. So big thank you, honestly, RNAO, for all the advocacy to elevate the role historically, really, in Ontario. We sit at the senior management table, I sit at the executive table on behalf of you, and well placed now in the structure to influence decisions. If it wasn't like this, if it wasn't placed in the place it is now in the system, I would not have been interested in taking this role on at this age and stage of my life. So I wanted to give you a sense, first of all, to tell you how proud I am, and I've always been very proud of RNAO for the work you've done and the voices I heard today. The strength and the will in those voices and the combination of data that you would illustrate a point with, combined with stories. You do advocacy like nobody else, and I hope you know what a difference you make, folks. So congratulations for, I think, a very successful Queen's Park Day today. I won't take too much of your time because I know I'm standing between you and you leaving. So 2 things I wanted to share with you. One was why I decided to take this role on at this time of my life. There is a meaning to it. And then I wanted to illustrate for you how your advocacy results in action. And I'll give you 3 or 4 examples of things that are moving forward in the right direction. Again, in no short measure because you have pushed it. And Doris talks about this, and I think it's absolutely right. When you place nurses properly in the system, inside government, and then the right people are doing the work outside the government. When that becomes like this, a dance that dances well, there is no shortage of things we can accomplish together. And I really feel there is an opportunity now like there never has been. First, because of what Paula said. We have a crisis in the system, an urgency like no other. I have not seen it. In the 30 years I've been a nurse, it's an opportunity. In that urgency are our abilities to open windows and doors in the way we've never opened before, because the traditional barriers that have existed are less, because we need more of everything. Therefore, anyone's ability to stand up and say, we won't allow NPs to do this, or we won't allow a scope of practice change, those are not the same barriers that I have felt. I'm a nurse practitioner, by the way, as well. It is not as it was in the past. So there is such an opportunity, honestly, for us. So the reason I came into the position was I find myself at this age and stage in life where I ask myself the question, where do I want to spend the next 5-10 years of my career? What difference do I have to make? Because I've always been driven by this idea of a cause, making a difference to the issues of the day, if you will. It's been a driving force for me. I'm an immigrant, as many of you know my story. I grew up in Tanzania. I lost family members, including my dad, at very young age because the healthcare system was the way it was. I lost my dad when he was 34 years old. Because first and foremost, there was no standard of care for what the condition that he had. And second of all, if that standard had been available, my family could not have afforded it. We were not rich. And every interaction that we had with the healthcare system where I grew up started with a visit at the business office. Until you transacted a sum of money, you could not get care. No one would lay eyes on you. I was 10 years old when my dad died, and I thought, this is wrong. This is absolutely wrong for healthcare, and I became an absolute ardent believer in publicly funded healthcare system. It should not depend on your ability to transact money. So it's been a real driving force for me. So with that, with the age and stage I find myself in my life, and then I look at the status, the state of our healthcare system, and people's interactions and experiences with it, it's unacceptable to me that primary care attachments are the way they are. 2 million people and more not having attachment to primary care. Guess what? My granddaughter Zoya was born 22 months ago. She doesn't have an attachment to a primary care provider. Her care since she was born, and I'm a damn ADM of health. What about people who are navigating this, who have very few connections or liberties or privileges that we have? My granddaughter doesn't have a primary care provider. Her care, since the day she was born, has been in walk-in clinics. And we've been desperately searching for NPLC in my region. It bothers me. At primary care, the wait times for mental health and addictions, the opioid issues that we have seen. As nurses, we are drawn by that social consciousness. It's the values. We cannot accept things the way they are. That's what drew me into this role. And of course, the HHR, just at the time when the population needs are the largest and the demographic is shifting towards an aging population, our health workforce is not healthy. It's a wicked juxtaposition of issues, but an opportunity. You have to be able to see an opportunity in it and a future that you're going to drive to that's better than today. So just to close, how effective is your advocacy is what I wanted to draw your attention to. So as a result of much work you do in your policy and advocacy, we are about to do a historical expansion to nursing seats in this province. So as you may know, in 2022, we added 1,000 registered nursing seats and 500 RPN seats. With this budget that's going to be tabled, we are doubling that number of new seats in the province. So 1,000 RN seats, 500 RPN seats, and 150, by the way, nurse practitioner new seats in the province. We only have 200 right now. So that will almost double the number of NP seats. So a big education expansion. And folks, you'll have to help me. I'm going to have, those of you who are educators in this room, I have to say, we will have to drive innovation in those seats. If we don't create HHR and nurses fast, keeping the education standard good and the same, we will replace nurses in Ontario. I'm seeing it. We need to graduate nurses fast, so we have to talk about compression of programs, multiple intakes in programs, do clinical placements 24/7. Nursing is a 24/7 endeavor. So we have to really reimagine our education system. Scope of practice. Our RN prescribing will move in Ontario if I have anything to do with it. And Doris and I will work together to make it happen. I've been talking about RN prescribing since the day I graduated. We're going to equally move some scope of practice changes for RPNs, but also removing further scope of practice barriers away for nurse practitioners. I can't believe it. I didn't know this because it's so different now for NPs than when I was practicing as an NP. Everything I did was with medical directives. We have so much more independence now. But I didn't know we could not certify death. That we could not order and apply defibrillation. Like what? We could not order nuclear medicine tests. It's all changing as we speak. So the scope of practice stuff is going to move forward significantly. I'm talking about 1 or 2 buckets of things we are moving, just to illustrate examples. There are 6 buckets of innovation that I'm pushing hard. International nurses is the other one, and we've made gains. I'm so glad we have a new CEO at the College of Nurses, Sylvie. She sees the light. She's emancipated nurse leader. There's our opportunity. You have to find, the stars are lining up, folks. In 2022, 40% of all new nurses who registered in Ontario, 40% were international nurses. And more, she's trying to reduce the time for registration for international. The last thing I would say, there are 6 buckets. I won't speak about all of them because we want to go home. I think the last one I will speak about is retention distribution. I would say this is the toughest bucket for me to lift, because in this bucket lies the issues of competitive compensation for nurses. It's Maslow's hierarchy, folks. If you want to talk about retention, you have to start with basic foundational issues that have to be dealt with right. And I'm glad you're openly talking about compensation. It's not easy for women to talk about compensation clearly. We deserve competitive pay for the work we do, for the knowledge, skill, and judgment that we have. Very tough one to lift and move. So we will need all hands on deck to move on that. Wage parity across sectors will never create integrated health system if we don't deal with wage parity. So I'm highlighting some successes for you, but I'm also telling you there is work for us to deliver together. I'll do my part of it, and I'll push hard. At this age and stage in life, both our Deputy Catherine Zan and I say to ourselves, we are fearless. We are fearless. We have to be. Because what's the worst that can happen? Fire us. This is the time to be fearless, folks. So we will be doing fearless things inside, and your fearless advocacy, continue, folks. It's working. I'm very proud of you. And Doris, as you are the driving force of it. So big thank you to you and to Claudette. Truly. Appreciate it, folks.
So thank you, Dr. Karima Velji, for those comments. And it's so good to know that RNAO has been there with you all along, pushing these issues. And we look forward to the future with the innovations. We're glad that you're at the table. We're glad we have representation at the federal table. We also remain here to help advocate. It's been a wonderful day, lots of learning from me. I'm sure you have learned things too. The passion, we've got to keep that going. It's authentic because we know what the stories are. It is good that we've had the meetings with the members of provincial parliament. And I also want to acknowledge the current government that 2 events late last year that Dr. Grinspan and I were invited to spoke to the importance of nurses and the respect for RNAO. Doris and I had the privilege of attending the swearing-in ceremony and also the throne speech, and we were the only nurses there. So we don't take that lightly. So we want to press forward on what the government has built, relationships mostly through our esteemed CEO, Dr. Doris Grinspan. I also want to take a moment to acknowledge our immediate past president, Morgan Hovarth. She is wonderful. There's a great distance between our age, but we come together when it comes to RNAO. And as Mike Schreiner said, we need to care. We need to care for one another. So when we care for one another, we won't have racism. We won't have discrimination. just as we care for our clients, let's continue to care for each other. Thank you. Thank you for your patience today in this my inaugural year as the president. Thank you. Thank you. Now, I believe we're heading back to our hotel. Siobhan, do you have specific instructions for us? I know that we have a meal at 6, and then we have our interest groups and presidents meeting. So any